une seule santé.
I am, therefore you are. What a powerful message. Your Excellencies, dear Presidents, Prime Ministers, Ministers, Members of Parliaments, members of the science, of the civil society, all of you, thank you so much for your presence and welcome to Lyon. My name is Eleanor Carrois, and I am the French Minister in charge of international partnerships, and I will have the pleasure of moderating this high-level session of the One Health Summit. It is my very pleasure to welcome you all for what has to be a turning point in the way we tackle global health. Governments, scientists, international organizations, philanthropies, private companies, and civil societies have gathered here in Lyon, a city with a historic and driving role in global health, to implement the One Health approach. But now, ladies and gentlemen, it is time to deliver. In a moment, we will have the honor of welcoming to the stage the co-chairs for this summit, the President of the French Republic, Mr. Emmanuel Macron, and the President of the Republic of Ghana, Mr. John Dramani Mahama. We will then invite 3 distinguished panels on stage to explore the fundamentals of the One Health approach and to announce concrete commitments. Before we begin, let me just give you a few housekeeping rules. A translation set is available on your chairs. You should be able to listen to the conference in English and in French. If you do not have a set, please raise your hand. Someone will bring you one. And now that I've made that announcement, and as Minister of Francophonie, you will allow me to switch to French. Sans plus attendre, je vous prie de bien vouloir accueillir très chaleureusement Monsieur Emmanuel Macron, Président de la République française.
Messieurs les Présidents, Monsieur le Premier ministre, Monsieur le Directeur général de l'Organisation mondiale de la santé, cher Tedros, Mesdames et Messieurs les dirigeants d'organisations internationales, Mesdames et Messieurs les ministres, Mesdames et Messieurs les parlementaires, Madame la préfète de région, Mesdames et Messieurs les élus, Mesdames et Messieurs, en vos grades et qualités, chers amis, c'est un grand bonheur, une grande fierté de vous accueillir à Lyon pour ce One Health Summit, comme vient de le présenter Madame la Ministre. Et avant toute chose, permettez-moi d'abord de partager avec vous la grande joie et le soulagement de savoir Cécile Kohler et Jacques Paris libres et sur le chemin du retour pour la France. C'est une formidable nouvelle, je pense à leurs familles, à tous leurs proches, à ceux qui se sont mobilisés. Et je veux ici dire ma reconnaissance aux services de l'État qui se sont mobilisés, à notre ambassadeur et l'ensemble des équipes. Mesdames et messieurs, nous sommes réunis à Lyon aujourd'hui, d'abord en l'occasion de cette journée mondiale de la santé. Le docteur Tedros nous le rappelait tout à l'heure, qui est une occasion pour nous de regarder le monde tel qu'il est. Un monde en crise, et des crises qui nous divisent, un monde avec des guerres qui viennent d'ailleurs bousculer nos enjeux d'approvisionnement, de sécurité, d'autonomie stratégique. Et alors même que les défis posés par la santé mondiale imposent plus que jamais de la coordination, de la coopération, nous avons une situation internationale qui vient fracturer celle-ci. Les guerres, je l'évoquais, les divisions, les baisses de contributions, les doutes qui ont été exprimés par certains sur notre organisation collective, laquelle a pourtant permis, durant le quart de siècle qui vient de s'écouler, d'obtenir des résultats inespérés en termes de vaccination, d'amélioration de la santé mondiale. Pour protéger efficacement sa population contre les menaces sanitaires, chaque pays doit s'assurer qu'il a accès aux données sur les virus qui peuvent venir de l'autre bout du monde, qu'il est en capacité de mener et d'accéder à une recherche de qualité, qu'il peut produire ou se procurer le matériel médical permettant de lutter contre la propagation des maladies, qu'elles touchent d'ailleurs les hommes ou les animaux. Et donc oui, nous avons besoin de coopération pour réussir en termes de santé. Et s'il est un domaine où la coopération internationale et interdisciplinaire est nécessaire, c'est bien celui-ci. Et c'est tout le concept de One Health. Ce concept ne relève pas d'un cercle d'initiés. Quand nous l'avons lancé il y a maintenant 5 ans, même un peu plus, il repose toujours évidemment sur des éléments scientifiques très établis, mais sur une réalité que nous partageons tous et que nous avons vécue il y a quelques années tous ensemble. Nous avons besoin, comme je le disais, de la coopération internationale pour faire face à ces crises. Nous avons besoin de la coopération internationale quand on parle de recherche, mais nous avons aussi besoin d'une coopération interdisciplinaire, car il est maintenant établi que la santé humaine, la santé animale, l'environnement, l'alimentation ont beaucoup à se dire, ou plutôt sont pleines d'interactions. Regardez les chiffres, ils sont là pour nous le dire. 75% des maladies infectieuses émergentes sont d'origine animale. Ce chiffre à lui seul justifie la réunion d'aujourd'hui. Et nous qui avons vécu, il y a quelques années, à peine un virus qui a mis à l'arrêt nos économies, nos sociétés, qui nous a fait vivre une situation ô combien cruelle dans tant de nos pays, la pandémie de Covid-19, nul n'a oublié aussi à quel point cette épidémie s'est mondialisée en quelques semaines. On pourrait convoquer ici le SRAS de 2003, le H5N1, Ebola, la liste serait trop longue pour la citer tout entière. Il n'y a plus à prouver que lorsqu'on parle de santé mondiale, on parle en effet de la nécessité de coopérer entre les disciplines que je viens d'évoquer et entre les pays. Cette année, la France a l'immense honneur d'assurer la présidence du G7 et d'essayer de bâtir des solutions concrètes, de la même manière qu'aux côtés du Kenya, nous organiserons le sommet Africa Forward à Nairobi à la mi-mai. Et donc, nous nous retrouvons aujourd'hui à Lyon, et dans un mois, nous serons à Nairobi pour avancer sur beaucoup de sujets, dont celui de la santé, et dans 2 mois, nous serons à Évian pour mobiliser le G7 et les pays partenaires. Et c'est pourquoi ce One Health Summit est si important. Il s'inscrit complètement dans cette chronique et nous avons voulu aussi permettre au G7 de relayer ces messages et ces avancées. Mais permettez-moi une seconde de dire ici l'importance de cette méthode. La méthode, c'est celle que nous avons bâtie depuis décembre 2017, celle des One Planet Summit. Ce sommet est le 9e dans le genre. Ces sommets, nous les avons bâtis pour réagir à la fracturation de l'ordre international. Rappelez-vous, on a bâti le premier One Planet Summit quand les États-Unis d'Amérique, déjà, nous disaient « nous déchirons les accords de Paris, fini les engagements sur le climat ». Alors on a dit « on va essayer de bâtir des coalitions d'acteurs pour sauver les accords de Paris ». Mais au fond, on va dire les scientifiques, les ONG, les gouvernements, les villes, les entreprises, les grands financiers, l'ensemble des acteurs, quel que soit leur secteur, qui sont prêts à se mobiliser et à bâtir une coalition d'acteurs, on les met autour de la table pour agir. On l'a fait ensuite sur l'océan, on l'a fait sur la biodiversité, nous l'avons fait sur les forêts, sur les pôles, et maintenant nous le faisons sur la santé. C'est cette méthode, bâtir des coalitions d'acteurs dans un ordre international bousculé, montrer qu'il y a un multilatéralisme efficace qui a aussi présidé au fameux pacte pour la prospérité, les peuples et la planète, le 4P, bâti en juillet 2023. Et les résultats sont là. Plus de 50 initiatives et coalitions concrètes qui engagent 140 pays, 3800 chercheurs conduisant des projets de recherche, Plus de 2 milliards de dollars mobilisés pour la transition et des investissements massifs pour protéger des écosystèmes, les forêts, les sols, etc., etc. L'approche One Health, fondée sur la science interdisciplinaire, comme je viens de le dire, justifiait pleinement de bâtir ce sommet avec cette même méthode. Pour la France, le One Health Summit s'inscrit dans une longue tradition d'engagement. Notre pays a cofondé le Fonds mondial pour la lutte contre le sida, la tuberculose, le paludisme et UNITAID. Nous sommes un bailleur historique de Gavi, l'Alliance du vaccin. Nous sommes leader mondial de la recherche, comme l'illustre le prix Nobel de médecine obtenu par Françoise Barré-Sinoussi et Luc Montagnier. Le pays qui héberge l'OMSA, pays champion de la santé mondiale, et en cela, Lyon en est sa capitale, accueillant en effet l'Académie de l'OMS, cher docteur Tedros, que nous avons inauguré en décembre 2024, mais aussi le Centre international de recherche contre le cancer et un One Health Institute. One Health n'est pas un slogan, c'est un concept opérationnel, et c'est pourquoi ce sommet est si important. Et je suis très fier de le co-présider avec mon ami et frère, le président du Ghana, le président Mahama, parce que nous voulons justement porter cette philosophie que nous avons développée ce matin avec nos collègues du Botswana, du Cambodge et de nombreux ministres et organisations internationales présentes. Nous avons réaffirmé et nous réaffirmons pour ce One Health Summit d'abord que toute avancée repose sur une science libre, ouverte, indépendante. C'est une nécessité absolue. La santé mondiale ne progressera pas si la science devient un instrument de politique ou un objet dont tel ou tel gouvernement dit « vous pouvez chercher ici, vous n'avez pas le droit de chercher là ». Non. La deuxième chose, c'est qu'elle suppose une gouvernance mondiale pleinement transparente, qui partage les informations à mesure qu'elle en dispose, de manière pleinement transparente, avec toutes ses parties prenantes. Ensuite, qu'elle impose une coordination à l'échelle internationale, dont l'OMS a la responsabilité, pour laquelle elle a la légitimité, articulant ensuite le travail des organisations régionales. CDC Africa est à nos côtés et joue un rôle ô combien important. On a pu parler ce matin avec l'Union africaine, mais ce rôle est essentiel. Puis nous avons réaffirmé l'importance de stratégies pensées, assumées par les pays, ce qui est exactement la philosophie que nous poursuivons. Et la nécessité en matière de santé intégrée d'avoir une approche pays qui agrège, synthétise ce qui est porté par l'ensemble des contributeurs. La Banque mondiale a fait des propositions importantes en la matière, dans une quinzaine de pays déjà. C'est cette méthode qu'il faut prendre, mais élargir pour faire des approches par pays pleinement intégrées qui mettent l'ensemble des contributeurs, Banque mondiale, OMS, l'ensemble des fonds verticaux et des pays donateurs, dans une approche pleinement simplifiée pour que les stratégies nationales soient accélérées. J'ai proposé, mon frère le président Mahama, que le Ghana soit le premier pays et projet pilote. Je crois qu'il a la vision, le leadership pour le faire, et nous y travaillerons à ses côtés dans les prochaines semaines. Et puis ce sommet permet d'avancer sur des chantiers très concrets. Je veux ici les lister très rapidement. Nous lançons un pacte international pour préserver l'efficacité des antibiotiques, avec des engagements à réduire leur usage inapproprié et garantir un accès équitable et durable aux antibiotiques essentiels. Bannir l'usage des antimicrobiens, encore trop souvent utilisés comme facteur de croissance dans des pratiques d'élevage. Et dans le même esprit, nous lançons un méta-réseau international sur la résistance aux antimicrobiens qui permettra de coordonner les efforts et mieux comprendre la menace à laquelle nous devons faire face. Deuxièmement, aujourd'hui, aux côtés de 6 autres États, nous nous engageons à soutenir et nous appuyer sur le groupe d'experts de haut niveau pour l'approche Une seule santé et inscrire durablement les enjeux de santé dans les négociations climatiques, les contributions nationales et les plans d'adaptation des États dans la continuité de l'ambitieux plan d'action de Belém issu de la COP au Brésil. C'est le sens de la déclaration One Health and Beyond. Troisièmement, nous contribuerons à un cadre volontaire pour mettre en commun et analyser les données de santé humaine, animale et environnementale de tous les partenaires. Et c'est ainsi que le One Health Data Convergence permettra de mieux comprendre et utiliser ces données pour éclairer la décision politique et développer des écosystèmes virtuels sur lesquels les scientifiques pourront tester leurs hypothèses. Partage de données, là aussi au service de la décision. Quatrièmement, à l'occasion de ce sommet, nous élargissons la coalition internationale de l'initiative PREZOD, Preventing Zoonotic Disease Emergence, que nous avions lancée lors du One Planet Summit de janvier 2021, que j'évoquais à l'instant, pour prévenir l'émergence de futures pandémies. Ces nouveaux partenariats permettront de déployer des projets concrets sur le terrain et de développer des réseaux de hubs d'épidémiologie pour l'observation, la caractérisation et le suivi de l'évolution des maladies. Cinquièmement, nous poursuivons notre mobilisation politique autour de l'indispensable traité sur la lutte contre la pollution plastique, soutenu par une déclaration de la communauté scientifique et un appel à l'action de représentants du secteur privé. En suivi de l'appel à un traité ambitieux lancé à Nice lors de l'UNOC 3, avec plus de 90 États, nous voulons redire aujourd'hui encore l'urgence d'aboutir à un texte qui aura un impact concret sur la lutte contre ce fléau. Sixièmement, nous avons adopté aux côtés du Kenya, de la Guinée, du Cambodge, de l'OMS, d'Africa CDC, du CGR, de la Pan-Africa Farmers Organization, une déclaration qui vise à converger autour d'une définition harmonisée des aliments dits ultra-transformés, à en reconnaître les impacts sanitaires et environnementaux. Pour ce faire, nous continuerons de soutenir les travaux internationaux en cours et veillerons à la mise en place de politiques publiques adaptées pour une alimentation plus saine et plus durable. L'année dernière, nous avions accueilli le sommet Nutrition for Growth et je me réjouis qu'une réunion de suivi ait pu se tenir hier et contribue à garantir le respect de nos engagements sur ces sujets essentiels. Septièmement, enfin, nous lançons le réseau One Brain Health pour comprendre et prévenir l'impact des transitions environnementales sur la santé cérébrale, dont la santé mentale. Nous ne sommes pas les seuls à nous engager et seront annoncés ici dans les prochaines heures des engagements des banques de développement, des organisations philanthropiques, des entreprises et bien sûr des gouvernements. Et je veux les en remercier toutes et tous. Dans le prolongement de ces engagements internationaux, nous structurons également au niveau national notre organisation autour de l'approche One Health. D'abord, le lancement des travaux d'élaboration d'une nouvelle stratégie nationale santé-environnement. Nous engageons une transformation des politiques alimentaires avec la mise en œuvre opérationnelle de la stratégie nationale alimentation, nutrition, santé, climat, à travers la publication du programme national nutrition santé 2026-2030 et du programme national pour l'alimentation 2026-2030. Ces orientations stratégiques définissent la politique du gouvernement pour une alimentation saine et durable pour tous à l'horizon 2030, en articulant les enjeux de nutrition, de santé publique, de durabilité de nos systèmes alimentaires et de souveraineté alimentaire. Deuxièmement, dans le même esprit de prévention des risques émergents, la France publiera un nouveau plan national relatif aux perturbateurs endocriniens, visant à renforcer les actions de connaissance, à réduire les expositions et à améliorer l'information des publics sur ces substances et leurs effets. Le plan visera en particulier à protéger les populations les plus vulnérables et les plus exposées en concentrant les efforts sur les impacts les plus préoccupants, l'infertilité, les troubles du neurodéveloppement, les cancers, etc. Enfin, la France s'engage à renforcer l'articulation entre science et décision publique en mettant en visibilité ses actions de recherche et d'innovation One Health, notamment autour de l'élevage, de la lutte contre les résistances aux antimicrobiens. En complément de la promotion d'un usage approprié de ces traitements et de mesures d'innovation, l'action nationale s'appuiera sur des dispositifs tels que les appels à projets éco-antibio qui permettent de limiter l'émergence et la diffusion de résistance chez les animaux et les risques qui y sont associés, ce qui fait l'objet de programmes de recherche que portent nos organismes ici présents. C'est pour cela que nous sommes réunis aujourd'hui à Lyon. Pour prendre des engagements concrets, je viens d'en citer quelques-uns au niveau national et au niveau intergouvernemental. Pour rationaliser aussi notre gouvernance, pour transformer nos politiques publiques. Tout cela sera synthétisé dans les engagements de Lyon, au cœur d'une approche, une seule santé. Et tout cela permet au gouvernement ici présent, aux organisations internationales, aux ONG, mais aussi à nos entreprises d'être pleinement mobilisées. Car pour mettre en œuvre cet agenda, il faudra aussi que l'innovation soit au rendez-vous, l'innovation dans nos laboratoires de recherche, qui permet de répondre à beaucoup des difficultés posées, de continuer les avancées, l'innovation aussi dans nos start-up, nos entreprises, qui portent une partie des solutions quand on parle justement de qualité de l'air, de qualité de l'alimentation, de qualité de nos eaux. Nous avons des entreprises, des solutions d'innovation qui permettent de relever aussi ces défis. Voilà, mesdames et messieurs, les quelques convictions que je voulais partager avec vous. Et dans ce moment où l'ordre international est bousculé et où d'aucuns ont voulu remettre en cause, au fond, le multilatéralisme en matière de santé, au-delà de ces 7 initiatives que je voulais souligner, de ces engagements de Lyon et des actions que mène le gouvernement, vous redire que la France se tiendra aux côtés de l'Organisation mondiale de la santé, aux côtés de l'ensemble des organisations internationales présentes pour défendre un multilatéralisme efficace, une vision exigeante reposant sur la science des décisions collectives que nous avons à prendre. Nous n'avons pas le droit d'oublier ce qui s'est passé hier. Nous avons le devoir de préparer les défis d'aujourd'hui et de demain. C'est à nous de faire, et c'est pour ça que nous sommes rassemblés à Lyon aujourd'hui et que plusieurs d'entre vous étaient ces derniers jours à Lyon pour les réunions qui se sont déjà tenues. Merci de votre présence, merci d'être là, et courage à tous, vive ce sommet One Health. Merci beaucoup.
Merci. Merci, Monsieur le Président. Merci, Monsieur le Président, pour ces annonces qui illustrent notre ambition collective. Merci aussi d'avoir rappelé que la science doit rester notre boussole pour toutes nos politiques publiques. I now wish to invite His Excellency John Dramani Mahama, President of the Republic of Ghana, to give his address as co-president of the One Health Summit. Excellency.
Thank you very much. Your Excellency, President of the French Republic, Excellencies, Heads of State and Government, Dr. Tedros Ghebreyesus, Director General of the World Health Organization, Mr. Ku Dong-yu, Director General of the Food and Agricultural Organization, and let me just say, distinguished delegates, ladies and gentlemen. I wish to begin by expressing my sincere appreciation to the government of the French Republic for convening this important summit here in Lyon, and to the quadripartite organizations for their continued leadership in advancing the One Health agenda globally. Thanks, Mr. President, for the honor of co-chairing this summit, and also thanks for the comprehensive introduction you have given. You really have set the tone for this meeting. We're living in truly interesting times, and much of what we previously took for granted is now being questioned, and our old answers have now become the new questions. To be honest, these shifts and cracks in world affairs are not limited to global health. They have spread across every corner of our shared global identity. But health, and global health in particular, is where things have come to a head. Around the world, we are facing an overwhelming surge of health threats across borders. Every species is in the crosshairs: animals, humans, and plants. And the environmental catastrophe confronting us is in the waves of the sea, it's in the glaciers, it's in the rainforests, it's in the desert storms. In my own country of Ghana, a blight of disease and pests affects smallholder cocoa farmers, threatening millions of households. Illegal gold mining leads to forest degradation and pollution of our water bodies, threatening the survival of precious populations of birds and insects critical to our biodiversity. At the foundation of all these crises is the phenomenon of climate change. And yes, we realize that everything is interconnected. From the outbreak of infectious diseases to antimicrobial resistance, and from climate-related disruptions to food systems, all these risks converge and intensify in frequency, complexity, and severity than at any time in human history. The One Health approach is thus a practical matter for us in Africa. We've traditionally lived our lives in lockstep with nature. We're an integral part of nature. Still, more than 50% of our population rely on herbs and other natural forest resources for their medicines. Our rich cultural heritage stands as a testament to the wisdom of an integrated approach to healthcare. Long before the coinage of One Health innovations, our ancestors had over the centuries mastered the use of plant-based therapies for animal healing, which in turn protected human health. In Africa, our lived experience leads us to accept without question that human survival, animal well-being, and plant health and environmental care form a single interconnected system. This system also integrates prevention, early detection, and swift response into a comprehensive whole that improves downstream medical care. We understand that our national development is rooted in resilient ecosystems and a strong public health system. Since the dawn of African civilization, from Songhai to Great Zimbabwe, from Timbuktu to Axum, and to ancient Egypt, traditional knowledge incorporated systems for diagnosing and treating chronic ailments, for dealing with plagues and pests, and even the practice of terrace farming. This knowledge has always been with us. What has been needed in recent times has been for experience to intersect with it. Over the past decades, we have faced pandemics and plagues, from COVID-19 to Mpox, Lassa fever, and Marburg. Each crisis has highlighted the importance of the One Health approach. We must reclaim our native practices and more actively draw on our heritage of integrated living across the continent. These public health emergencies have also taught us a simple truth, that prevention is not only more effective, but also much more cost-effective than cure. And so in Ghana, our rollout of the Ghana Medical Trust Fund and our free primary health care programs are all new instruments to improve health outcomes for our population. These two programs will aim at lifestyle changes and preventive care, incorporating traditional knowledge. We must also take note of the changing disease burden in Africa, including the explosion of morbidity in non-communicable diseases. In Ghana, non-communicable diseases today account for 42% of all mortality. Infectious disease burdens also are changing, are varying. And so we must take note of all these. The drivers of today's health threats, from climate change and ecosystem degradation to species conflicts and loss of natural barriers, are reinforcing each other. Not to talk about plastic pollution, which is poisoning all our ecosystems. We must advance international action in dealing with plastic pollution. Regrettably, as I speak to you today, the countries that are most at risk have the least resources to cope. This must change. The world must face the stark and uncompromising fact that a healthy and thriving Africa is no threat to anyone. It will be a positive force for global progress. We must therefore ensure fair access to financing, technology, data, and innovation. We need to enhance research and knowledge sharing. Additionally, we must support countries in building resilient systems that can prevent, detect, and respond effectively. Although we have frequently discussed this, we have been slow in developing the necessary infrastructure for delivery. Let's muster the political will to integrate our fragmented regulatory environments and let Lyon be the turning point. Today, however, I wish to make 3 calls to action, and I hope we can all commit to these immediately. First, let us shift from commitment to action. The period of declarations must come to an end. The moment for coordinated effort is here, and let us start from Lyon. Let us connect our One Health strategies for our national development agendas to a new global framework for public health. The international security agenda must fully adopt this approach as a key element of sustainable development worldwide. And thirdly, let us concentrate on building a new preventive shield and an intelligent radar system at its source. Robust surveillance systems, early warning mechanisms, and community-level interventions are our strongest defense against future pandemics. But these must be smart, dynamic, agile, and interoperable, lest we simply add new bureaucracies to old ones. The decisions we make at this summit will shape the future of global health security. And so let us ensure that they result in tangible, measurable outcomes for our people and our planet. I thank you for your kind attention.
Thank you, Excellency, for your words, and in particular for this call for action. I am sure in this room many will hear it, and many will continue to work together towards this One Health approach. So we're really grateful for Ghana's leadership on global health, and notably on the Accra Reset. One Health repose sur un dialogue entre les disciplines et sur une coopération internationale efficace. C'est pourquoi les Nations Unies jouent un rôle absolument essentiel, en particulier les agences qui forment part de la quadripartite et que j'aimerais remercier très chaleureusement pour leur implication, c'est-à-dire l'Organisation mondiale de la santé, l'Organisation mondiale de la santé animale, l'Organisation des Nations Unies pour l'alimentation et l'agriculture et le Programme des Nations Unies pour l'environnement. Je vous propose à présent d'écouter le message de M. Antonio Guterres, secrétaire général des Nations Unies, qu'il nous a adressé.
Excellences, en cette journée mondiale de la santé, nous sommes rappelés à une vérité essentielle. Il ne peut y avoir de santé durable sans respect de la nature, sans prévention des risques et sans coopération internationale. La santé humaine, la santé animale et la santé des écosystèmes sont indissociables. Pourtant, les ravages du dérèglement climatique, la pollution, la destruction de la biodiversité et les inégalités brisent cet équilibre et multiplient les risques sanitaires, nutritionnels et zoonotiques. Et c'est également une question de justice. Les communautés qui ont le moins contribué à ces crises en paient le prix le plus cher. L'approche « une seule santé », fondée sur la science, la prévention et la solidarité, est un enjeu de survie collective et notre meilleur atout de réduire les risques avant qu'ils ne se transforment en crise. Elle doit nous aider à réduire les inégalités, à protéger les plus vulnérables et à réaliser l'agenda 2030. Faisons du sommet de Lyon un tournant, avec des engagements concrets, des financements à la hauteur et une volonté politique sans faille au service de la santé des personnes et de la planète. Je vous remercie.
Alors, messieurs les présidents et monsieur le secrétaire général viennent de nous rappeler les fondamentaux de cette fameuse approche One Health. D'abord, il faut anticiper et prévenir les crises plutôt que de les subir. On sait évidemment que c'est beaucoup moins cher et puis ça nous évite des catastrophes. Il faut décloisonner nos approches pour passer d'une logique en silo à une logique véritablement en réseau. Et puis, il faut surtout agir sur les causes profondes, penser à une logique à long terme et puis coopérer. Nous ne pouvons rien faire sans la coopération internationale et je sais que vous êtes évidemment convaincus. Ce sommet, mesdames et messieurs, doit démontrer l'efficacité du multilatéralisme, mais aussi, et peut-être surtout, les vertus d'une expertise scientifique. alors qu'elle est contestée, noyée par un déferlement de fausses informations, d'opinions, de confusion érigée en système. Nous voulons au contraire que la science guide toujours notre action, qu'elle légitime notre ambition et nos politiques publiques, notre coopération. C'est pourquoi la communauté scientifique a tenu, elle aussi, à vous adresser un message qui nous vient de loin, de vraiment très loin. Moi, je vais vous inviter à lever les yeux et à laisser la parole à l'astronaute française Sophie Adhanom, qui nous a aussi adressé un message.
Monsieur le Président, Mesdames et Messieurs les chefs de gouvernement, Mesdames et Messieurs les ministres, Mesdames et Messieurs, bonjour, bonjour, depuis l'espace. Je suis heureuse de m'adresser à vous aujourd'hui pour introduire les travaux scientifiques menés par une communauté internationale large pour préparer le sommet qui vous réunit aujourd'hui, One Health. Depuis l'ISS, je ne vois pas de frontières, seulement un système vivant, fragile et interconnecté. À bord, mes expériences comme EFCO-Finder pour la télémédecine ou l'étude de ma densité osseuse me rappellent une vérité cruciale. La santé humaine ne peut être protégée de manière isolée. Elle est le maillon d'une chaîne indissociable reliant les écosystèmes, les êtres humains, les animaux et notre environnement. Et c'est le cœur de l'approche de ce sommet aujourd'hui. Plus de 300 experts scientifiques mondiaux se sont concertés depuis plusieurs mois et se sont réunis hier pour échanger cette vision globale de la science et de l'environnement au service de tous et préparer des recommandations à votre attention. Comme moi qui admire notre planète d'ici, belle et fragile à la fois, les scientifiques ont rappelé l'importance de la recherche scientifique pour faire avancer la connaissance et alimenter le processus de décision publique et politique. Cela est toujours vrai en matière de santé planétaire et nous-mêmes astronautes y travaillons tous les jours. Les recommandations que vous allez débattre traitent des maladies infectieuses émergentes, de la résistance aux antimicrobiens, des pollutions et des systèmes alimentaires, car ce sont les grandes priorités de recherche définies par la communauté. Ils constituent les piliers du sommet One Health. Les enjeux sont nombreux et vastes tout au long du processus scientifique. Mesurer avec précision, comprendre les phénomènes pour anticiper et prévenir. La complexité des interactions entre l'homme, le monde animal et leurs environnements impose de nouvelles approches scientifiques à la croisée des sciences les plus fondamentales, de l'épidémiologie et des sciences humaines. Et ces interactions constituent en soi un immense champ de recherche et j'espère, moi aussi, y contribuer à mon humble échelle. Les contributions de toute la communauté scientifique internationale permettent à la recherche d'avancer en reposant sur le partage et probablement demain sur l'intelligence artificielle pour traiter l'immense quantité de données. Un grand merci aux scientifiques pour ce travail considérable. Le One Health Summit doit être le moment où nous brisons enfin les silos. La science nous montre le chemin, à nous de passer à l'action. La Terre est notre seul vaisseau spatial. Prenons-en soin.
Nous remercions Madame Adhanom pour ce message très puissant. Et puis j'aimerais aussi remercier chacune et chacun des scientifiques qui sont ici, présents à Lyon, qui sont venus parfois de très loin et qui ont, pendant toute la journée d'hier et une bonne partie de la journée d'aujourd'hui, débattu, discuté, alerté, interpellé les gouvernements, les responsables politiques, les membres de la société civile. C'est ça l'esprit du One Health. Et puis, vous l'avez compris, le président de la République nous l'a rappelé, le One Health, cela doit être du concret. Alors, nous allons passer maintenant à 3 panels, à 3 débats qui seront aussi l'occasion de faire des annonces concrètes. Le premier sur le rôle de la science, le deuxième sur la prévention des maladies transmissibles et enfin sur les maladies non transmissibles. Il y aura beaucoup d'annonces cet après-midi, alors tenez-vous prêts. Pour commencer, comme je vous le disais, je vous invite à explorer le rôle de la science pour guider l'action et l'innovation en nous appuyant sur pas moins de 47 recommandations qui ont été formulées par les 300 scientifiques qui étaient réunis hier, ici, dans la ville de Lyon. I will now give the floor to the moderator of this first panel, Dr. Richard Horton. He's the chief editor at The Lancet, whose One Health Commission played a very important role on a global policy shift. Dear Dr. Horton, I will invite you to the floor and we'll leave it to you.
Bonjour, mesdames et messieurs. Aujourd'hui, c'est un honneur d'être votre modérateur pour ce panel. We meet at a time on World Health Day, no less, when cooperation is interpreted by some as weakness, when public trust is being challenged by disinformation, and when prosperity is increasingly elusive for many of our communities. And yet, for those of us who've worked in global health for decades, we know that political commitment, international partnerships, and science-based decision-making can accelerate action, unlock resources, and save lives. This summit can mark the beginning, we hope, of a new era of multilateral commitment and partnership. So let me welcome our first panel. Please give a round of applause for Mr. Joseph Sikela, European Commissioner for International Partnerships. Mr. Zhu Dongyu, Director General of the Food and Agriculture Organization. Mr. Khaled El Anani, Director General of UNESCO. Dr. Sanya Nishtar, Chief Executive of Gavi, the Vaccine Alliance. Sanya. And Mr. Akihiko Nishio, Vice President of Development Finance at the World Bank. And John Arne Rottingen, who is the Chief Executive of the Wellcome Trust. But our first speaker today, please welcome His Excellency, Duma Gideon Boko, the President of the Republic of Botswana.
Thank you very much. Let me begin by gratefully acknowledging the President of the French Republic and thank him most profusely for inviting all of us here today to participate in these very, very important discussions. Let me also thank and acknowledge each and every one of you individually and personally, and thank you so much for the privilege of your company at this event today. It's a great privilege for me to be here with you in Lyon during the 2026 World Health Day, united under the theme, ecosystems, plants, animals and humans, an action and solutions summit to improve the health of all life and the planet. The theme highlights our shared responsibility and it underscores the interconnectedness of the health of all living beings and our planet, a principle that is integral to not just the world's well-being, but Botswana's national strategy. In our country, Botswana, the One Health approach is a vital economic and social necessity, as our economy is interconnected with people's lives and livelihoods. It is connected with ecosystems. The cattle industry in Botswana you know, because we supply beef to the EU, is critical, important for rural livelihoods, and it faces persistent risks from zoonotic diseases such as foot and mouth and Rift Valley fever. We look to you, the scientists, for durable solutions to these pressing and trenchant problems that trouble our country and trouble the world. We saw during the COVID-19 pandemic vulnerabilities, some of them fatal sounding in human lives and livelihoods, exposed, laid bare. And they cost, for a small country like Botswana, of a population of 2.5 million, around $200 million US. And this excludes the economic disruptions from lockdowns. We've strived, despite all these challenges, to maintain a fair bit of robustness in our surveillance infrastructure and our scientific expertise. We hope to hear from yourselves today some serious measures and interventions that add to our few faltering steps as a country. We've had a fair share of participation with our scientists. Our national laboratory network has shown commitment to genomic sequencing, and this positioned us among the first during COVID to detect and analyze the Omicron variant. Our scientists transparently shared this information with the international community, enabling a prompt and effective response. This exemplifies the principles of One Health, highlighting and demonstrating the power of scientific vigilance, global solidarity, transparency, collaboration, and collective effort. We also must point out that with over 40% of our total land reserved for protected areas, wildlife conservation and management, the health of our ecosystems, wildlife, human populations become inextricably linked. Climate change continues to intensify disease outbreaks, as evidenced by the Rift Valley fever occurrences following heavy rains. And we are beginning in Botswana to experience phenomena that we've never seen before. Sometimes it snows there, and we might think we're now becoming Switzerland, which we must be economically, minus some of the snows and other unglazed ferocities of nature. We've now begun to experience floods, even in areas that were desert. It's very strange, has undermined our infrastructure. And so we must begin to focus on climate-resilient infrastructure at the same time that we wrestle with these vagaries. And so we look to you, especially, and I have had a conversation with UNESCO, and they have committed, at least to me, and I stated publicly, so I commit them in front of you to participating actively in helping Botswana in relation to its water and other challenges. We reaffirm our commitment to working together with yourselves, with the international community, and to ensuring that we address these common challenges together in unison. Even as the challenges mount, even as the multilateral order is experiencing a vicious pushback from certain powers, we must forge ahead, make forward strides, our gaze firmly fixed on a future that we all must share in and participate in shaping. And so, Botswana, I must assure you here and now, stands ready to play its part as it always has and always will. And we look forward to joining hands with each and every one of you and all these eminent organizations at the front lines of finding sustainable solutions to the pressing challenges that face the world. So thank you so very much for your presence here today and the privilege of your kind attention. Thank you so very much.
And it's now my pleasure to welcome John Arne Rottingen, the Director and Chief Executive of the Wellcome Trust, to offer his remarks.
Thank you so much, Richard, and Excellencies, Ministers, distinguished delegates, and ladies and gentlemen. I'm really delighted to be able, on behalf of Philanthropies, to present some highlights from the Declaration of Philanthropies, and we are pleased from the Wellcome Trust to be able to have been developing this declaration together with friends and colleagues from Fondation Merieux and Fondation S. And in reality, the declaration sets out three messages. One is that we really need to sustain investments in research, in product development, and in strengthening systems to deliver scientifically based solutions, and this is more needed than ever. Second, we need a One Health lens on this, and that has been excellently demonstrated so far in this summit. And in particular, in the context of climate change that we just heard from Botswana, that is even more important than ever. And third, Philanthropies, we are really proud to play a role in the system. That's dear to our heart. We have played that role in the past. We want to continue to play that role. But we need to understand that our role is only catalytic, complementary, and driving collaborations. We cannot drive the real action and the real change. So my message to all of you today is that we are, as Philanthropy, committed to partnerships, to collaborate. We need to tackle climate change. We need to tackle the infectious disease threats that are linked to climate change and to the One Health agenda. But we can only do it in partnership, in collaboration with governments, with industry, with civil society. Global health has delivered results through partnerships and collaboration, and we can continue to deliver that. Our part is to be catalytic, collaborate, but we will never substitute, we will never be able to fill the gaps that really need to be filled by public and private investments in One Health. Thank you.
Thank you. Thank you, John Arne, and thank you for all the work you do, and I know you now have to depart for the airport. Our next speaker, Mr. Joseph Sikela, European Commissioner for International Partnerships. Welcome, sir.
Thank you very much, Monsieur le Président, honorable heads of states and heads of governments, excellencies, ministers, honorable guests. I am here today to show that Europe does not make only commitments. Europe delivers on them. In global health, words are not enough. What matters is whether systems work when people need the most, whether a child receives treatment, whether a country can contain an outbreak before it crosses a border, whether our partnership hold under pressure not only in good times. Remember, friend in need is friend indeed. This is the standard we have committed to. This is a strategic investment, not a gesture. Weak health system can become a starting point of the next global crisis. A local outbreak becomes a global emergency, and the fragile systems collapse under pressure and take economic stability with them. The cost of reaction is always much greater than the cost of prevention. So when Europe invests in global health, we are being very, very practical. We invest in security, in stability, in better protection of our citizens and of our partners. And today, we are here to commit to work together on One Health by uniting human, animal, and environmental action. We can turn prevention into power and set the global standard. So let me be very, very concrete about what we can announce right here, right now, as a new commitment to One Health action at global level. We continue our strong support to the Global Fund to fight AIDS, tuberculosis, and malaria, one of the most effective health partnerships the world has built. It has saved 65 million of lives, 65 million, since 2002. And since 2002, the European Commission has contributed 3.5 billion, together with the member states, 3.5 billion euro. Team Europe represents around 1/3 of all donor contributions. At a time marked by turmoil and doubt across the world, we will not step back. So for the next replenishment, the Commission intends to pledge 700 million, and today I'm announcing the investment of 185 million euro already for the first year. So together with the member states, thank you. Together with the member states, Team Europe's total contribution will exceed 3 billion euros. Malaria still threatens millions of lives, most of them children. And we know how to prevent it. We know how to treat it. What is needed is scale and sustained commitment. So we need to provide both, and Europe already does. But our investment goes beyond global funds. Through Global Gateway, we support partners in Africa to develop their own production of vaccines and medicines, as well their capacity and knowledge in One Health. Health dependency is vulnerability. COVID demonstrated that clearly. We are working to make sure it does not happen again. We have already invested 40 million in partnership with the Africa CDC, supporting preparedness, surveillance, and health workforce development. Today, we go further. I'm proud to announce a new 46.5 million package to build health security across Africa and Europe, bringing together ECDC, Africa CDC, and the European Food Safety Authority in a One Health approach. 46.5 billion euro. And this is a clear signal. Europe remains committed, even if others pull back or replace cooperation with conditionality. Health risks do not remain local. Our response should not either. And we are also investing where emerging threats require it. Antimicrobial resistance is already a big problem today. Common infections are becoming harder to treat, and that is why I'm making another announcement today. We will commit 30 million euro to research and develop new treatments. Because we need a reliable pipeline of effective medicine, and that requires investments. And let's go further still on dengue. 300 90 million people are affected every year, and the disease is spreading, including into Europe. So I can also announce here, we will invest 20 million euro to develop new treatments, working with the French Development Agency and the Drug for Neglected Diseases Initiative. Underpinning all of this, in the Global Health Resilience Initiative announced by President von der Leyen last September, and which will launch very soon during the month of May. So this will not be another framework, but a practical and powerful tool with a clear objective to effectively build a health system that can prevent, prepare, and respond. So it will focus on three main areas. First, a global health architecture that is fit for purpose, with the WHO process in the center, more coherent and generally tailored to country needs. Second, country-led health system and regional manufacturing, meaning stronger primary health care, better preparedness, and local production of vaccines and medicines in Africa, in line with Global Gateway. And, yeah. And last, science in the center, driving evidence-based action on antimicrobial resistance, climate-linked diseases, and future pandemics. So, with trust, with resources, and with a strong and fair partnership, it should work for all of us. Thank you very much.
Let me move on right away to Mr. Khaled El-Anani, the Director General of the United Nations Educational, Scientific and Cultural Organization.
Thank you, Dr. Horton. Excellencies, Head of State, Government, Ambassadors, civil society, private sector, Head of International Organization. I'm delighted to be here to attend One Health Summit. Maybe some may ask why UNESCO, an organization associated to culture, is invited to a forum dedicated to One Health, because for more than 80 years, UNESCO has been safeguarding fundamental human rights, including a very important right is right to science and its benefit. UNESCO has a strong scientific mandate. We have 3 sectors dedicated to science: natural sciences, including water, biodiversity, and social and human sciences, and the famous IOC, the Intergovernmental Oceanographic Commission. UNESCO acts as one science approach, as a normative leader, including global standards like the genome, the Universal Declaration for Genome since 1977, the ethical approach frameworks like ethics of bioethics, ethics of AI, and recently, last November, ethics of neurotechnology. And of course, we promote open science across our member states. UNESCO also serves as a catalyst of international cooperation, North-South, but also South-South and Triangle cooperation. We are a capacity builder. We support member states to strengthen scientific ecosystem. We serve also as a bridge between science, policymakers, and society, integrating academic, indigenous, and traditional medicine and knowledge. UNESCO has a very wide network of scientific institutions around the world. We have more than 1,100 UNESCO chairs, dozens of Category 2 centers, more than 10,000 associated schools, and very well-recognized international prizes for sciences. We convene a global dialogue in science. We received only a few weeks ago the World Brain Health Forum. As we believe, as it was mentioned many times, that health goes beyond the human being. It's also about animals, environment, and biodiversity. And UNESCO contributes to this agenda in a unique way. In water, through our intergovernmental hydrological program, we do research on water. In ocean, through the IOC, where we observe the ocean, we monitor the ecosystem, changes and risks. And in sites, we have more than 2,000 heritage sites, natural sites, biodiversity sites, and geoparks around 170 countries. And always our study and our approach is relating the sites with the livelihood, and the local communities. One Health is also, above all, about people. So through education, we foster sustainable development in education. We integrate climate, biodiversity in education, health and well-being in curricula. And of course, we advance STEM education, mainly in Africa, and to special focus on women and girls. We work with the indigenous people and knowledge system, and we strengthen media and information, of course, literacy, and we support the journalists during health and environmental crisis. As our commitments, it will be less than the previous speaker, but we will continue advancing One Health education agenda, integrating this approach into our education for sustainable development, education for health and well-being programs. We'll be continuing deepening scientific cooperation, including formalizing our partnership with Global Exoposum Forum. We will work with our sister agencies on a global call for One Health research to be launched under the International Decade of Science for Sustainable Development. We'll support innovative initiatives such as our partnership with Plastic Odyssey, and we'll join efforts with France to advance the One Brain Health Forum. Thank you very much.
Thank you. Thank you very much, and it's wonderful to have UNESCO as part of the One Health family. It's a great pleasure to introduce my friend and colleague, Dr. Sanya Nishtar, who is the Chief Executive of Gavi, the Vaccine Alliance.
Thank you very much, Richard, for moderating and anchoring this segment of this very important meeting. Excellencies, heads of state and government, ladies and gentlemen, all protocol observed. Let me begin by paying rich tribute to President Macron and President Mahama for their leadership at a very critical juncture in the history of global health. We truly are very grateful to you as the community, larger community of global health. One Health is clearly a true manifestation of multisectoral action. We've been talking about multisectoral action for a very long time, and now is the time to integrate it and institutionalize it in policies and practices and financial systems, because this is an opportune time to do that. We are talking about reform of the global health architecture. We're talking about, at this very meeting, increased salience to the local reform of the local health architecture, and there's every reason that we should integrate the One Health approach into these reform recipes. And today's summit and the force of political will behind it demonstrates that it is feasible to do that, and this is extremely encouraging. Let me also recall today that there appears to be a consensus in terms of where we're headed. We all agree that attainment of national health sovereignty is a foundational principle. We all agree on the need for a lean global health public good system with regional empowerment. And there appears to be some alignment that in a resource-constrained environment, we should prioritize the most vulnerable and strengthen our collective defenses, especially in fragile and humanitarian settings. I'm pleased to let you know that at Gavi, these goals have been at the heart of our reform process called the Gavi Leap. And our principles are country centricity, country sovereignty, focused mandates, and finite lifespans for international development institutions. Our reform is positioning Gavi for a future global health architecture. We are committed to reform of the global health architecture. We are committed to reform of the local health architecture. And we are being very bold in our approach to usher in changes, transformative changes, at a very fast pace, and learning and taking remedial action as we go along. So today, Excellencies, ladies and gentlemen, as part of our reform process, I'm honored to announce 2 new initiatives which will see us work even more closely with countries and with regional partners to strengthen health sovereignty and to strengthen immunization in fragile and humanitarian settings. Firstly, as many of you may be aware of an initiative called the African Vaccine Manufacturing Accelerator. Thanks to the generosity of our donors, this is a $1 billion subsidy mechanism to promote commercial vaccine manufacturing on the African continent. And I'm humbled and honored to say that this is the largest global investment in African vaccine manufacturing to date. And today I'm humbled to announce that after carefully listening to African leaders, African institutions, manufacturers and partners, I will be taking, excuse me, I got a very bad throat bug when I was in Pakistan last week. After listening carefully to our stakeholders, I will be taking to our board this July an additional package of up to $200 million of investments in vaccine manufacturing on the continent. We're calling this financial instrument AVMA Plus, and this is meant to provide support beyond the existing subsidy mechanism. It is meant to provide upstream support. This is an ask from the continent, and I believe that this targeted and time-bound support will accelerate the journey of African manufacturers from investment to production to market. This is what is exactly needed. This is what I've heard, we have heard over and over again from stakeholders, and this is what we've heard from leaders like President John Mahama and the President of Botswana, who are here with us today. My second announcement relates to a strategic shift that Gavi is making towards strengthening immunization in fragile and humanitarian settings. Unfortunately, we're in a context where we are increasingly coming across such situations. So we are first time inaugurating a rapid response facility called the Gavi Resilience Mechanism to ensure that immunization is at the heart of the response to crises in fragile settings. And we look forward to working closely with the European Commission. We heard from Commissioner Sakela that the EU resilience mechanism, the detailed modalities of it will be launched later this summer. We look forward to working very closely with you, and we look forward to making sure that we exploit synergy to the maximum. And I'm very pleased to announce, thanks to the generosity of our donors, that up to $380 million is being committed to the Gavi Resilience Mechanism. This funding instrument is designed to mobilize and deliver flexible and targeted support during outbreaks, emergencies, natural disasters, and conflicts. And I just want to I think that our sovereign donors deserve the applause, and I really want to thank them for that. And I just want to clarify that the Gavi Resilience Mechanism is going to complement Gavi's existing emergency and outbreak response mechanisms, which is our strategic stockpiles, the Day Zero financing facility, which also includes the First Response Fund, which we successfully invoked for the first time during the Mpox continental emergency. So let me say in the end that in the context of our broader reforms, these two new instruments actually demonstrate that Gavi can square the circle of multilateralism and national health sovereignty. And as we can do that at the same time as strengthening global public health goals that not only protect the most vulnerable, but also safeguard our collective security. I thank you.
Thank you, Sonia. Thank you, Sonia. Let me now go to Mr. Akihiko Nishio, who is the Vice President of Development Finance at the World Bank.
Thank you. Je vais commencer avec quelques mots en français. Je voudrais bien remercier Monsieur le Président et aussi le gouvernement français, Madame la Ministre, et aussi la ville de Lyon pour cette occasion vraiment très spéciale. J'ai appris beaucoup, j'ai apprécié beaucoup les avis de mes collègues. Et j'ai trouvé que les discussions étaient vraiment inspirantes et franches et ouvertes. Et je pense que c'est un esprit qu'on doit garder en futur. Ok, je vais changer en anglais maintenant. So I would like to mention 3 things from the part of the World Bank. First of all, I'd like to say that since 2021, the World Bank Group has been a very steadfast supporter of One Health and has an estimated 34 projects and approximately $4 billion in commitments across health, agriculture, and environment, which is 2.5 times higher than the same duration of time before the pandemic. And subject to country demand and board approval, the World Bank Group will invest in new projects totaling $750 million US, 750, over the next years for One Health activities across the portfolio. I'd also like to add here that in addition to the financing, we would also like to contribute on the knowledge side. We have launched a knowledge bank where we curate and share knowledge across the institution, also with our partners. So we would very much like to proceed on that path. Second, the World Bank Group plans to endorse the Public Development Bank's joint statement in support of investments in One Health. So we are very happy to do that. Third, as part of this effort, the World Bank Group is working with other development banks to establish a common framework for financial tracking. And we are committed to doing further work on this with our colleagues from partner organizations. And fourth, we are pleased to announce a new engagement with PREZOD. Over the past year, we have been exploring different opportunities in Africa, and we can now confirm that we are going to collaborate with PREZOD on a regional health program in West and Central Africa, strengthening the One Health implementation in a region that is central to global disease surveillance and pandemic preparedness. So in closing, let me just reiterate how much I look forward to working with all of you on this very, very important agenda, which I think is a matter of foundations of growth and foundations of security for the world as a whole. Thank you very much.
Friends, this is an action summit. It's about deeds, not words. So let me thank our panel for their leadership and commitments today. My personal dream would be to make Lyon for One Health in 2026 what Alma Ata was for health in 1978. Why not? Everything and anything is possible. And so now please welcome our final speaker, Mr. Zhu Dongyu, who is the Director General of the Food and Agriculture Organization.
Mr. Moderator, Honorable President of Botswana, Honorable Prime Minister of Cambodia, ladies and gentlemen, we are approaching the close of this panel. We got to know reconfirm the power of science and the governance and the finance. We have the more than 60 years close cooperation with World Bank, a year physically, financially also. Together with other agencies like UNESCO, we are promote science together, especially for agricultural agri-food systems. Now it's time to turn the ideas to actions that safeguard health and prosperity. Science gives us evidence. Finance makes action possible. Governance ensures it's all come together. The vitamin M. It's make stick together. Evidence alone does not change the world. It must be coupled with strong institution, multi-sector collaboration, and strategic decision-making. Today, we want to emphasize the critical role of the effective governance, but One Health can go beyond the human health. Ministry of Agriculture food systems are fundamental. I said health from the health food, from health soil, health water, health air. If we don't have health air here, I think all of you will run out to the street and to the mountains and rivers. It is encompass animals, plants, soils, water, and microbiome, the interconnected system that sustain life, food, feed, and livelihoods. While the agri-food system thrive, they support the four betters: better production, better nutrition, better environment, and better life, leaving no one behind. One Health is everyone's and sustainable health. Our well-being is inseparable from that of the animals. Our ecosystem, the governance must reflect that the reality across all sectors. Agri-food system employ over 1 billion people worldwide, support the livelihood of nearly 40% of global population, and ensure the health of 8 billion. It's coming 10 billion, 2050. FAO serves as a global convener of science, policy, technical expertise, connected the research community with the government to translate the knowledge into the concrete solutions at the national level on the ground. I'm pleased to announce FAO is launching Global Partnership Program for Transboundary Animal Disease. We need more people, more members, more partners involved. That's Global Partnership Program. Through this program, together with our partners, we aim to strengthen surveillance, preparedness, coordinated response to transboundary animal disease. Because animal disease don't respect the boundary. And protect the agri-food system, trade, and the rural livelihood. Data and knowledge are also critical. The One Health Agri-Food System Knowledge and Intelligence Hub will bring together data, analytic, scientific expertise from cross-discipline to support evidence-based policymaking and coordinated action worldwide. Yesterday, I had the honor to meet the young leaders at the youth event. Their energy, curiosity, and vision gave me great confidence. I was a scientist for 25 years. So on the biology and the genome sequencing. So I trust them. They can carry forward One Health governance in the years to come. They can regionalize the energy of this mission together for the future. Young scientists, the innovators will play the decisive role in shaping next generation of One Health solutions, from digital to all the advanced technology which did it. I'm warmly welcome all of you to the FAO Global Conference on Action on One Health in Agri-Food Systems, supposed to determine to do already in Rome. From 21st to 23rd September, I am invited 100 ministers, not only from Minister of Agriculture, Minister of Health, Minister of Environment, and Minister of Economy, who are willing to come. And also, World Food Forum, I established 5 years ago. Last year, we had 15,000 participants in person, almost 500,000 online within 5 days. That will be happening this year, 12 to 16 October. October 16 is the birthday of FAO. So we use that, also World Food Day. And that's why we established World Food Forum, which will provide the opportunity to continue to translate commitment made at this summit into concrete solutions. Together, we can learn together, we can work together, and we can deliver together, and make this planet for sustainable forever. Thank you so much.
Okay, that's it.
Thank you very much to all of our great panelists. Please join me in giving them a real great round of applause. Thank you all. I wanted to congratulate you all for these very exciting announcements. And we look all forward to the conference in September on agri-food systems. Car si nos réponses doivent être internationales, elles doivent aussi être locales, ancrées dans les territoires. Les collectivités sont en effet en première ligne face aux crises sanitaires, climatiques et environnementales. Ce sont elles qui organisent l'accès à l'eau et aux services essentiels, qui planifient l'aménagement urbain, qui luttent contre les pollutions, qui protègent aussi la biodiversité dans nos villes. Alors je vous suggère maintenant d'écouter les recommandations des élus exprimées par le maire de Lyon et le maire d'Akonolinga au Cameroun. Over to them.
Dans nos territoires urbains, nous subissons les effets de différents phénomènes qui affectent notre santé. Pollution de l'air, vagues de chaleur extrême, inondations, insécurité alimentaire, perte de biodiversité ou encore émergence de nouvelles maladies. Ces phénomènes sont liés les uns aux autres et ils s'intensifient. Mais ils ne touchent pas tout le monde de la même manière. Dans toutes nos villes, les inégalités sociales et territoriales façonnent l'exposition au risque, la vulnérabilité et l'accès aux solutions.
Face à ces défis, les villes agissent déjà. Partout dans le monde, les élus locaux améliorent la qualité de l'air, transforment les systèmes alimentaires, protègent la biodiversité et renforcent la résilience face au changement climatique. Car dans les villes, une évidence s'impose. La santé humaine, la santé animale et la santé des écosystèmes sont indissociables.
C'est précisément le sens de l'approche One Health. Les villes sont idéalement placées pour la traduire en actions concrètes en reliant les politiques de santé, d'environnement, d'urbanisme, d'alimentation et de climat. Mais aujourd'hui, nous devons franchir une nouvelle étape.
Si les crises sont globales, les solutions commencent souvent dans les villes. C'est pourquoi nous lançons aujourd'hui un appel clair, la création de la One Health City Alliance, coalition internationale des villes engagée pour mettre en œuvre concrètement l'approche One Health.
Il est temps que les villes du monde unissent leurs forces pour faire de One Health une réalité sur le terrain. Cette coalition permettra de partager les connaissances, de développer des solutions communes et d'accélérer les politiques urbaines qui améliorent simultanément la santé des populations, des animaux et des écosystèmes. Car les défis auxquels nous faisons face dépassent les frontières de nos villes et de nos pays, mais les solutions peuvent aussi dépasser ces frontières.
En unissant les villes du monde autour de One Health, nous pouvons transformer nos réponses locales en un mouvement global pour les sociétés plus saines et plus résilientes. Ensemble, faisons des villes les moteurs d'une nouvelle alliance entre santé, environnement et climat.
This is a very powerful message. And again, cities, communities are at the heart of what we're aiming to do today. Maintenant, nous allons passer au deuxième panel, un panel qui est intitulé « Surveiller, détecter, anticiper, reprendre l'avantage face aux risques sanitaires ». Ce deuxième panel doit nous aider à mieux comprendre les enjeux de surveillance face aux risques sanitaires, car la science nous le dit, vous le savez, mesdames et messieurs, cela a été répété plusieurs fois au cours de ce sommet, il est environ 100 fois moins coûteux d'investir dans la prévention que de remédier aux conséquences des crises sanitaires. Dans ce que l'on peut appeler le monde d'après, que nous sommes en train de construire après la récente pandémie, deux questions vont guider nos débats au cours de cette table ronde. Sommes-nous vraiment prêts à faire face aux prochaines crises ? Je pense qu'on a la réponse, en tout cas on se dit qu'on peut faire mieux. Et que devons-nous donc faire pour être plus coordonnés, mieux préparés et pouvoir répondre de manière efficace ? I would like to invite on stage Ms. Emma Ross. She's the director of the Global Health Program at Chatham House, and she's also a renowned specialist of global health. She will be moderating the second panel. Madam Ross, over to you.
Thank you. So I must apologize in advance. My intro is not going to be as jazzy as Richard's was, so sorry for that. But as the title of our panel suggests, we're going to hear today some of the political commitments being made to strengthen the way we tackle outbreaks using the One Health approach. There is clearly a lot to do at the political level, but the truth is that One Health lessons we've learned over the years were not applied in the COVID pandemic. There wasn't the prevention, in part because we had no integrated disease surveillance across humans, animals, and the environment, and upstream drivers were still neglected. We had no One Health preparedness strategy, and the transdisciplinary capacity was underdeveloped. There was no One Health response to speak of. Silo systems were not bridged. We didn't manage the spillback from animals. So One Health was more a rhetorical banner than an operational reality in the response to the pandemic. The pandemic did certainly elevate One Health on the political agenda. Clearly, we're here today. And I'm looking forward to hearing today from our panelists what they're planning to do to make One Health work on the ground. So I'd like now to invite our panelists to join me on stage. First, Dr. Emmanuel Macron, Director General of the World Health Organization, the World Organization for Animal Health. Dr. Philippe Dunton, Executive Director of UNITAID. Please join us. Take a seat. Mr. Alain Mérieux, the President of the Institut Mérieux. Mr. Peter Sands, Executive Director of the Global Fund to Fight AIDS, Tuberculosis, and Malaria. Welcome, Peter. Just next to Alain. And last but not least, Mr. Stavros Nicolaou, Group Senior Executive for Strategic Trade at Aspen. So welcome all of you. Now I'd like to invite to the podium our first speaker. So this is not all we have more. Please welcome His Excellency Samdech Mohabovor Thipade Hun Mane, Prime Minister of the Kingdom of Cambodia.
Excellency, distinguished delegates, ladies and gentlemen. It is my honor to join the One Health Summit 2026 on the World Health Day today. I highly appreciate the government of France for hosting this summit at such a pivotal moment for humanity and our planet. All of us can still remember the outbreak of the COVID-19 pandemic. Despite being an under-resourced country, Cambodia's containment of COVID-19 is widely regarded as notable success from a strict containment phase to high vaccination recovery phase. Humans, animals, and their environments do not face separate risks. They share the same destiny. This gathering provides a platform to reshape traditional approaches toward a One Health culture, a systemic, integrated, and unifying approach to safeguard human, animal, environmental ecosystems. Global progress is evidence. With advances in genomic sequencing, along with recognitions of climate change and biodiversity loss, and as drivers of One Health risk, countries are strengthening governance, adapting environmental safeguards, integrating surveillance systems, and addressing zoonosis linked to deforestation and wildlife trade. Yet significant challenges persist. Pandemic risks from pathogen spillovers due to wildlife trade, disrupted ecosystems from climate change, all of which require coordinated global actions to build resilient One Health systems. Cambodia has consistently demonstrated its commitment at all levels. Domestically, Cambodia has addressed One Health risks through surveillance and community engagement across multi-stakeholders, monitored wild bird migration and ecosystems, and advanced biosecurity and risk-based approaches to animal health while improving infrastructure, surveillance, and markets and logistics. Internationally, we remain committed to the WHO's pandemic agreement and its AMR surveillance systems, an environmental initiative like Global Plastic Action Partnership, as well as other important initiatives under the ASEAN frameworks. Excellencies, the time has come to translate our commitments into bold actions. Allow me to share 5 insights. First, on partnership and solidarity, we should further advance regional and global collaborations, share knowledge, resources, and technology across governments, scientists, civil society, and communities. Second, on integrated surveillance and early warning system, we should continue to harmonize standards, expand genomic sequencing, and ensure rapid responses. Third, on sustainable financings and innovation, we should further mobilize long-term international mechanisms, increase domestic investment, and foster public-private partnership. Fourth, on combating antimicrobial resistance and climate pressures, we should further promote responsible antibiotic use, enhance monitoring regulatory reform, and integration of climate safeguards into health and agricultural policies. Fifth, on promoting knowledge, equity, and preparedness, we should ensure evidence-based policy, invest in laboratories and workforce development, guarantee equitable access to life-saving tools, and empower communities through awareness. Excellencies, ladies and gentlemen, now it is time to transform momentum into lasting impact. Together, we must scale up collaborations, strengthen preparedness, secure sustainable financings, and promote equity at the core of One Health. Together, we can translate today's progress into global resilience and benefits people, animals, and ecosystems everywhere. And thank you very much for this opportunity. Thank you.
Thank you, Prime Minister. Thank you. So thank you, Prime Minister, for sharing the priorities from your perspective. As you say, there is a lot we should and must do going forward. And we look forward to seeing what comes next for Cambodia's engagement in advancing One Health. Minister Planas, next I'd like to welcome His Excellency Luis Planas, Minister for Agriculture, Fisheries and Food of the Kingdom of Spain, to outline Spain's One Health priorities and commitments.
Merci, Mesdames, Messieurs, chers collègues. Juste quelques remarques. J'ai déjà intervenu ce matin sur l'analyse qu'on faisait sur les conséquences de la santé animale sur la santé publique et l'environnement en jouant avec les 3 éléments pour le futur des orientations que nous allons prendre collectivement. Mais je voudrais à ce point, dans une brève intervention, mentionner et commenter les engagements publics que l'Espagne fait en clôture de cette session sur 4 points concrets qui nous semblent très bien montrer la portée des efforts que cet événement et cette rencontre peut tenir compte. Surtout en tenant compte que c'est uniquement sur la base de la coopération internationale qu'on pourra effectivement achever et sur une base totalement transversale entre les différents éléments, les objectifs que nous avons discutés longuement entre hier et aujourd'hui. Le premier, c'est la déclaration en faveur d'une diète qui soit saine et soutenable et la garantie pour tous de la souveraineté alimentaire. C'est une question qui est absolument clé et on ne peut pas y oublier. En tant que ministre de l'Agriculture, de la Pêche et de l'Alimentation, cette question de la sécurité alimentaire me tient à cœur, je crois, tous les participants de cette rencontre, mais aussi le caractère sain de nos produits qui sont effectivement consommés par les citoyens. C'est pourquoi c'est important d'adopter une déclaration internationale sur les produits ultra-processés, dont on doit arriver à une définition qui nous permette de prendre des mesures vers le futur. Je préfère très largement l'évidence scientifique sur le sujet qui a été présentée jusqu'à ce moment et qui continue à être développée dans le futur immédiat. La deuxième, c'est la question des data, des données sur lesquelles nous basons nos raisonnements. Je crois que c'est une question absolument essentielle. On parlait ce matin justement à quel point, par exemple, sur la question des processus zoonotiques avec de caractère vectoriel, on devrait obtenir, et c'est un bon exemple, des données qui soient harmonisées entre les différentes parties prenantes. Mais c'est plus large que ça. Tous les éléments qui interviennent du côté de l'environnement, du climat, de l'agriculture, de la biodiversité et même les aspects sociaux doivent être tenus compte et c'est important effectivement qu'on puisse obtenir une approche commune et une harmonisation des données sur le sujet. La troisième déclaration me semble clé. C'est le pacte international pour préserver l'effectivité des antibiotiques. C'est une question dont on a mentionné largement aujourd'hui dans plusieurs interventions. Je l'ai fait moi-même ce matin. C'est une question qu'on ne peut pas mettre de côté. C'est une question absolument fondamentale. On ne peut pas utiliser les antibiotiques, je parle de l'élevage, dans l'alimentation animale. C'est absolument clé. Et cet élément dans lequel, par exemple, dans le cas de l'Espagne, depuis 2014, on a réussi à éliminer 70% de tous les antibiotiques qui étaient utilisés dans le passé, mais il nous reste certainement encore du chemin à faire sur la matière. On va publier cette année, pour la première fois, aussi les données sur les animaux de compagnie. C'est un élément clé, et comme je dis, c'est la troisième déclaration qu'on soutient de notre côté. Et finalement, celle qui se réfère à la restriction de l'utilisation intentionnelle du micro- ou nanoplastique dans les produits utilisés dans notre vie journalière. C'est absolument clair que, de ce point de vue, tous les produits nanoplastiques ou microplastiques sont des éléments terriblement nuisibles, pas seulement pour l'environnement, mais aussi pour notre santé, et il faut travailler dans leur élimination. Je conclus. Je crois que de tout l'esprit de ces déclarations, comme ces deux débats de ce matin et cet après-midi, montrent à quel point nous sommes prêts à converger sur une action internationale qui doit être coordonnée. Le rôle de l'OMSA, le rôle de l'FAO, le rôle de l'OMS, le rôle de l'Organisation des Nations Unies pour l'environnement bien coordonné est un élément fondamental vers notre futur. Et en tant que représentant de l'Espagne, je parie pour ce futur, pour tenir nos engagements et pour avancer. Encore une félicitation pour le gouvernement de la France pour l'organisation de cette rencontre. Merci pour votre attention. Merci.
Thank you. Please now join me in welcoming His Excellency Aaron Motsoaledi, Minister of Health for the Republic of South Africa.
Madam Moderator, Emma Ross, Honorable Ministers, Excellencies and colleagues, it is a profound honor to represent South Africa here in Lyon, as we gather to strengthen our collective One Health defenses. Making our food system safe and sustainable is not merely a technical goal, it is critical for public health, our economic growth, and our collective social well-being. The One Health approach reminds us daily that human, animal, and environmental health are inextricably linked. Nowhere is this more evident than in our food system. Food safety is a challenge that cannot be managed by any single sector alone. It requires a coordinated, decisive action across an increasingly complex landscape. Today, that system stems from farm to fork and from sea to plate. And as we look to the future and new technology, it may even extend from laboratory to plate, where a single animal cell can be transformed into edible meat. To manage this complexity effectively, we must work together to prevent foodborne illnesses, including zoonotic agents, to identify all risks at the earliest possible stage, and respond with speed and precision to outbreaks and emergencies. When we do this, we do more than just manage a system. We will be protecting lives, building trust, and supporting long-term development. In South Africa, we are translating these principles into high-impact national initiatives. We have established a One Health Food Safety Technical Working Group to bridge the gap between the sectors. We are strengthening our food emergency alert and recall systems, improving our capacity for rapid risk assessment during outbreaks. Crucially, we are developing integrated data systems to ensure that our reporting is as fast as the risk we face. Our efforts are firmly aligned with global frameworks, including the Sustainable Development Goals, the International Health Regulations, and the One Health Joint Plan of Action. Guided by these pillars, South Africa is committed to strengthening our national health system through improved coordination, collaboration, and communication. In closing, a safe and resilient food system is the bedrock of a healthy nation. Through this coordinated One Health approach, South Africa remains steadfast in its commitment to protecting our people and their environment, strengthening our food systems, and contributing to global health and food security. I thank you.
Thank you, Minister. I'm going to now turn to the panelists who are here with me seated on stage. Can I start with you, Dr. Dunton, for UNITAID's activities in this area?
Yes, thank you, Emma. Maybe I need a microphone. This is working. No, thank you, Emma. And I will start to say that I will not try to be pinky, rosy, or something this, describing at least the situation and the diagnostic we have for potential future pandemic. I just want to thank Peter and the Global Fund during the difficult time of COVID-19, and especially because we were in charge of the therapeutic pillar, and it was not the easiest one, I have to say. And it turned, by the way, that the situation in particular in Africa was the lack of access to oxygen. And I think that most of the people who die actually in Africa die from a lack of access of oxygen. And so that's why we create the coalition with WHO, with a lot of partners, and I want to call also Dr. Barbosa, Director of PAO, who is now the actual co-chair. A lot has been made, a lot needs to be made, even in the difficult situation we face in finance. We have been lucky during the COVID-19 because we had a vaccine that works, even in a way it was not totally expected, let's be honest. And we don't know if it will be the case in the future. So despite the best effort of the industry, of CEPI, we are facing like a dozen of pathogens identified by WHO. And in France, we don't have the tools. And I think that the lesson we learn through the pandemic is when we are not ready, it's a problem. And we are running after a virus that we don't control. And this is a situation we may face again in the next 20 years, according to the best expert and analysis of WHO. So there is a track, there is some progress in terms of vaccine, but we are not there. But we need to realize that even if we have a vaccine, have a therapeutic and a diagnostic is key in the response. For many reasons, because of science, but also we need to be honest, because of politics. The acceptation of the vaccination, even when you have evidence, is not a given. So we need to have different tools. What is not rosy is the outcome of trying to repurpose drug. Frankly, according to WHO, more than 90% of the clinical trials to look after the efficacy of repurposed drug fail because of the design, because of the power, because it was a wrong drug, because of a lot of things. By the way, the only one that went very well was in UK to demonstrate the efficacy of dexamethasone. But beyond that, a lot of effort, a lot of money, and no results. Another thing we learn is also the fact that if you don't think about access at the beginning, also it doesn't work. You need to have a tool, but you need to have a tool that is accessible, available, and usable in the north and in the south. So there are characteristics. So just to say that there are some progress. There are some progress with WHO. We've launched this morning with WHO Cork, with CEPI and NRS. I think that the science is absolutely important, but we are thinking, we have been working along this 18 months with IPPS. Victor Zhou, co-chair, is in the room. And we decided that first we don't want to create a new organization, because it would be insane, but instead to prefer to have a coalition that will help and enable the work in terms of strategic direction, scientific support, developing the platform. And we have been working with the NDI, we have been working with MPP, we have been working with Intrepid from industry. We need industry to develop its tools. And we have a project now that can be up and running. It's absolutely key, but I have to say that we need money. So we have looked at a lot of commitments. We are looking at the strategy of ERA at the European Commission, which is really, really good. Some member states, but there is a fatigue. You know, nobody wants to talk about the pandemic situation. This is, I think, a problem. But again, I think that we don't have a real choice, and we really need to make things moving and happening. So thanks for the support. Thanks for, and I will come back to you with Victor, because really we need to move the needle as soon as possible. Thank you.
Thank you, Dr. Dunton. Indeed, I totally agree. The therapeutics arm is a little weak. So you all heard that. It needs funding. That's how we get from concept to reality on the ground. So I'd like to move now to Mr. Merrieux to share with us what the Institut Merrieux's perspective is on this. We'll pass the microphone.
Bien, je parlerai français, si vous permettez. Ce que je peux dire, c'est l'expérience d'une longue vie d'industriel dédié à la biologie, d'abord dans les vaccins très longtemps, 30 ans de ma vie, vaccins humains et vétérinaires, et c'était déjà One Health. Et puis ça a été ensuite le diagnostic, ouvert également aux deux médecines, et puis la sécurité alimentaire sur laquelle nous avons travaillé. Donc ça a toujours été une approche planétaire, mondiale je dirais, et surtout complètement One Health. Ce que je peux dire, c'est que le diagnostic dans tout cela a pris une part importante. Déjà dans les vaccins, il fallait identifier la souche. Quand on a eu le outbreak au Brésil de la méningite, il a fallu identifier une bactérie qui était d'origine africaine, le méningo A, et qu'on a pu vacciner parce que nous avions préparé ce vaccin à cause des besoins, en particulier de l'Afrique au Sahel. Ça a été la même chose pour la fièvre afteuse dans notre domaine. Il fallait sans arrêt adapter le vaccin aux souches. Et lorsque l'on a été, on évoquait déjeuner avec, au Botswana dans les années 80, il a fallu identifier des souches qui étaient South African type, nouvelles. Il a fallu produire sur place. Donc le diagnostic a toujours pris une part importante et il devient, je dirais, de plus en plus important. Vous l'avez vu dans les grandes épidémies qui nous ont frappés, le sida, la Covid, mais également l'Ebola. Et dans l'Ebola, nous avons fait, il y a 6 ans, un laboratoire à la demande de notre ami le professeur Mouyambé, nous l'avons fait à Goma, en RDC, et le directeur de laboratoire que j'ai revu avant qu'il devienne rwandais, pour parler de ce qu'il a fait. Bon, il a travaillé d'abord sur l'Ebola, ensuite il a travaillé sur la Covid, ensuite il a eu le retour du Marburg, donc de l'Ebola, et puis récemment il a eu le monkeypox. Montrer qu'en quelques années, 5 ans, ce laboratoire a dû faire face à de nombreux virus émergents, ce qui montre le monde qui est en face de nous, c'est-à-dire un monde qui est excessivement mobile et une multitude de virus émergents nouveaux. Et l'autre phénomène, la résistance des bactéries aux antibiotiques, qui sont deux phénomènes aujourd'hui qui frappent le monde et qui, je dirais, qui n'ont pas de frontières entre nous, pas de frontières entre l'homme et l'animal et pas de frontières géographiques. Donc c'est dans cette approche que nous sommes assez contents aujourd'hui, parce que ce n'est pas moi, mais ils ont aujourd'hui travaillé pour regrouper 25 signataires, ont pris l'engagement de travailler ensemble au développement et s'engagent au lancement d'un pacte pour le diagnostic. Ça a été le Diagnostic Compact Global Health qui s'est décidé aujourd'hui. Ces 25 participants, industriels, grands organismes et gouvernements qui vont se mettre ensemble pour travailler justement à une approche diagnostique qui soit sans frontières et qui soit One Health. Car encore une fois, toute l'expérience que j'ai pu avoir sur le terrain, en particulier lorsque j'étais au moment du earthquake en Haïti, où on a vu vraiment que c'était une seule santé. Et il y a eu le outbreak, et ensuite il y a eu des problèmes évidemment de médecine, de vaccination, de diagnostic, mais également les problèmes de l'eau, les problèmes de la pollution, les problèmes de la nutrition, de l'alimentation, qui sont des problèmes de plus en plus importants et que l'on ne peut pas dissocier de notre approche biologique. Nous étions récemment encore à Madagascar. À Madagascar, à quoi ça sert de vacciner les enfants s'ils n'ont pas les protéines suffisantes parce qu'ils sont en sous-alimentation? Et quand vous allez à l'hôpital de pédiatrie de Tananarive, la principale ville, première cause de mortalité, dénutrition aujourd'hui. Donc c'est une bataille mondiale, One Health, mais qui va très loin et qui englobe beaucoup plus, je dirais, que la biologie classique. Alors aujourd'hui, quelles sont les conclusions que je peux tirer de ce monde qui bouge? La première, c'est que nous gardons profondément une vision pasteurienne. J'ai eu le privilège d'avoir un grand-père, mon grand-père, qui a travaillé en 1894 avec M. Pasteur. Et nous avons toujours gardé de cette approche, une vision qui est planétaire, qui est sans aucune frontière entre les deux médecines, sans frontière avec l'alimentation. M. Pasteur travaillait sur l'alimentation, sans frontière entre les pays, entre les religions, entre les revenus économiques. C'est un message pastorien très fort qui est aujourd'hui, à plus d'un siècle après, d'une acuité et d'une violence extraordinaire aujourd'hui. Donc gardons cette vision pastorienne parce qu'elle vient de loin et qu'elle est plus encore ardente que jamais. La deuxième expérience que j'ai tirée de toute cette longue vie, c'est une stratégie qui est proche de la bactérie. J'ai beaucoup d'admiration pour les bactéries parce qu'elles s'adaptent sans arrêt à un environnement qu'elles n'aiment pas, qu'elles ne contrôlent pas. Et c'est ce que nous devons faire nous-mêmes avec humilité, s'adapter au bouleversement climatique, au bouleversement scientifique, la biologie moléculaire, l'intelligence artificielle arrive, change beaucoup de choses, s'adapter au bouleversement démographique. Quand je suis né, 2 milliards d'habitants, aujourd'hui 8 milliards d'habitants, et très localisé au sud et pas tellement au nord. Et puis aujourd'hui, plus que jamais, et là on est gâté, au bouleversement géopolitique auquel il faut s'adapter. Alors faisons humblement comme les bactéries, pas trop de discours, mais adaptons-nous de façon permanente à faire face aux multiples défis qui sont les nôtres. Et je pense qu'une réunion auquel je suis très sensible parce qu'elle se tient à Lyon, ce One Health Summit, est très important parce que je crois qu'il aura rassemblé beaucoup d'énergie pour se battre contre pour un défi qui nous dépasse tous séparément mais qui peut nous réunir plus que jamais. Merci.
Thank you, Mr. Murray, and for reminding us that our understanding of the connectedness goes back quite a long way. I'd like to turn to Mr. Sands now to share with us what's going on with the Global Fund.
Thank you. I'd like to focus my remarks on malaria, in part because of the 3 diseases I'm charged with, HIV, TB, and malaria. It's the one that keeps me awake at night. And in part because it's an infectious disease that absolutely demands a One Health approach. Now, you may say that's a bit easy because it's a mosquito-borne disease and therefore, of course, it involves animals. But it goes beyond that. The number of mosquitoes that can transmit malaria is actually highly influenced by agricultural practices, by sanitation infrastructure or the lack of it, by climate change, including extreme weather events. If a child does get bitten, their risk of death is hugely affected by whether or not they're malnourished. Their survival rates fall very rapidly with malnutrition. Communities have known for generations that keeping a village clear of unnecessary vegetation or getting rid of stagnant water, of planting plants that deter mosquitoes are part of good malaria control. And arguably the most cost-effective large-scale intervention, one that drove much of the progress we've seen against malaria, has been the insecticide-impregnated bed net, which is absolutely a One Health intervention. But it also illustrates the challenges because over the almost 2 decades that we've been using these nets, the mosquitoes have gradually become resistant to the most commonly used insecticide. And so together, actually, with Philippe and his team at Unitaid and with some private sector manufacturers, we worked on developing and piloting a new generation of dual active ingredient nets. Dual simply means they've got 2 insecticides, so if a mosquito's resistant to one, it's highly likely that the other one will kill it. These were rolled out at scale in sort of 23, 24, and they cost 70 cents more than a conventional insecticide-impregnated bed net, and are about 45% more effective. So it's no surprise that actually the vast majority now of the roughly 200 million bed nets a year that we fund countries to procure are these new dual AI nets. The need for a One Health perspective is also illustrated when you consider one of the most kind of interesting and potentially exciting innovations to fight malaria, which is gene drive, genetically modified mosquitoes. If you were taking a narrow human health perspective, the idea that you could sharply reduce the number of mosquitoes, or you could make it more difficult for them to transmit the malaria parasite, seems like a bit of a no-brainer. But if you take a broader One Health perspective, a whole set of quite concerning questions come to your mind about, well, what's the broader environmental impact, like on the food chain and so on, and how do we manage those risks? This is not to say we shouldn't pursue such innovations. We definitely need new tools to fight a disease that is killing a child every minute. But we should do so taking that broader view of what the potential risks and considerations might be. Malaria surveillance is another area where this is intricately entwined with One Health considerations. We're helping countries link their meteorological systems with their malaria surveillance systems so as to better understand and hopefully predict what extreme weather events might do to malaria incidence. We're helping them track specific malaria species. There's a particularly nasty piece of work called Anopheles stevensii, which is a mosquito that likes urban areas and also likes to bite during the day. Understanding the spread of that is critical to understanding the epidemiology of malaria. And we're helping track parasitical resistance. We're seeing increased incidence of resistance to first-line treatments. And again, we've seen this happen. In the early 60s, malaria became resistant to chloroquine, and we saw a massive surge of deaths. We want to make sure we're ahead of that, because it will happen. We are seeing increasing artemisinin resistance. The challenge, of course, with all this kind of surveillance is the geography of malaria. Malaria is at its worst in the poorest and often most conflict-ridden places. Doing this kind of complex surveillance is difficult enough in a stable, relatively wealthy place. It's extremely difficult in a conflict zone. I mentioned all these things because they're all sort of intrinsically One Health in nature. Of course, there are innovations in the malaria space which are more narrowly human health, whether it's better vaccines, better diagnostics, new first-line treatments, new prophylactics. But ultimately, if we're going to beat malaria, we have to crush transmission, and transmission means beating the mosquitoes, and that inevitably means taking a One Health approach. The Global Fund provides almost 2/3 of all international funding for malaria programs. By the end of last year, our cumulative investment in fighting malaria amounted to about $21 billion US. Today, I'm announcing that we will invest more than $3.5 billion in malaria programs across more than 60 countries over the next 3 years. And this funding will help avert over 300 million cases of malaria and will save more than 4 million lives. Now, we can only do that because of the long-standing and extremely generous support of donors. And I would like to acknowledge Joseph Sikela's announcement earlier this afternoon of the European Commission's €700 million contribution to the next grant cycle of the Global Fund. The European Commission has been a steadfast supporter of the Global Fund. And I'd also like to acknowledge that France, too, continues to be a very strong supporter of the Global Fund. Indeed, it was here in Lyon that President Macron hosted our very successful 6th replenishment in 2019. But we have to do better against malaria. We had 2 decades of great progress. Progress then stalled, And when the numbers come through for 2025, I'm afraid we will see that more kids will have died in malaria in 2025 than in 2024. Curable disease. Every child that dies of malaria is an avoidable death, is an avoidable family tragedy. It affects the very poorest in the very poorest countries. And with sustained funding, with the kinds of innovations I was talking about, with the kinds of One Health approaches I mentioned, we can beat malaria. Countries have done it. It requires political will, it requires resources, it requires ingenuity, but it can be done, and we should do it. Thank you.
Thank you so much for that quite concrete commitment there. To say the least, something else that is funded. Excellent. Lastly on our panel, before we go to Dr. Subaran for kind of closing, is Dr. Nicolaou. Please tell us what Aspen is up to in this space.
Thank you very much, Emma. Let me greet all the colleagues and excellencies. It's a wonderful pleasure to be here today with you in Lyon. Before I make my commitments, Emma, some prefacing remarks. Firstly, what does One Health mean to us? It means having health security in every single corner of the world, just very simply put. Regrettably, we are enormously far away from achieving that. And Africa is probably the furthest from achieving that. That's my continent, where I come from. And it's important to reflect on one statistic, which is that Africa is home to 15% of the world's population, yet it harbors 25% of the global health disease burden. So you can see the disproportionality in all of that. And I needn't remind anyone in the room that during COVID, regrettably, Africa found itself at the back end of the queue. Africa resolved that that should never be repeated ever again. And a commitment was made in 2022, in fact, May 2022, at a head of state bureau meeting, which coincidentally President Macron attended, I remember very well. The commitment was made that Africa should procure 60% of its pharmaceuticals, vaccines, and other medical countermeasures from Africa by 2040. And in fact, President Macron has been a great advocate, an avid advocate of health equity, health sovereignty, and vaccine equity in Africa. So it's opportune that we're meeting here today in Lyon. Now, Emma, let me get to the commitment, because that's what we're here for, right? To kickstart Africa's ambition of 60% of its vaccine, pharmaceutical, and other medical countermeasures procurement by 2040, what I referenced earlier, Aspen, which incidentally is the biggest investor, South African investor in France, and we're also the largest pharmaceutical investor on the African continent. We will commit to 3 things here today. Number one is we will pre-qualify 2 important pediatric vaccines used in routine vaccinations. I'll name the vaccines. They're a hexavalent vaccine and a pneumococcal vaccine. So we will pre-qualify those before the end of this calendar year. It's a pity Dr. Tedros left the room earlier, because we're going to be quite reliant on him, but he has made that commitment himself. The second commitment is that we will go into manufacture of these vaccines by late Q4 this year and early Q1 of 2027, which means African patients will start to benefit from these vaccines. And I needn't remind anyone in the room that outside of clean running water, the next best preventative measure is vaccines. Now let me get to my third and final commitment, which is many speakers here today have spoken about the rising tide of non-communicable diseases. And I think many people think that this is an affliction that is very specific to mainly developed and mature economies. Well, it's not. We face a massive rising tide of non-communicable diseases, particularly things like diabetes. Type 2 diabetes is becoming endemic on the African continent. It's linked to obesity. It belongs to a complex of diseases called cardiometabolic renal complex of disease, and it is sinister in the extreme. So we will commit today that we have worked as Aspen Pharmacare with Novo Nordisk, the Danish company. We will contract manufacture human insulin, which will be used for consumption mainly in Africa from May 2026. So that's in about a month's time. Novo Nordisk will do the distribution, and I do want to thank, and I hope the Minister for Francophonie and International Cooperation, she's sitting in front here, will convey this message personally to President Macron, that he was the European leader that came out during COVID and supported Africa. And we have never forgotten that as Africans. Thank you very much. Merci beaucoup.
Thank you, Dr. Nicolaou, and thank you to all of the panelists for outlining your commitments. We've seen commitments on key aspects of One Health outbreak control, including cooperative initiatives on the key tools of diagnostics, vaccines, and therapeutics. There's a lot here, and some of it's even funded, which is great. I'd just like to close my part by saying again that what I hope for is to see this turned from commitment to reality, and that this whole agenda really does get translated in a way that we face the next pandemic threat more effectively than we did last time. So with that, I'd like to hand over to Dr. Soubeyran to conclude for us on this panel. Thank you.
So, Excellencies, distinguished speakers, ladies and gentlemen, we live in a world where converging crises, food insecurity, climate change, biodiversity loss, and geopolitical instability. But beyond these global trends, today's exchanges have reminded us of a persistent and yet often preventable risk, zoonotic diseases. Rift Valley fever, West Nile, tuberculosis, and so many others continue to affect us and to claim millions of human lives every year. Today, it has been said already, but around 60% of human infectious disease and nearly 75% of emerging infectious disease originate in animals. And these biological threats, whether natural, accidental, or intentional, deliberate, are increasing in complexity. And as previous speakers emphasized, security does not begin during crisis. Security begins with prevention. Yet, despite clear evidence, we continue to underinvest in this first line of defense, in particular in animal health systems. And let me, as DG of the World Organization for Animal Health, give concrete figures. Animal diseases reduce livestock production globally by 20%, costing farmers an estimated cost of $300 billion every year. And yet, veterinary services, animal health systems, receive on average less than 0.05% of national GDP. At the same time, the resources required to strengthen these systems, veterinary systems, globally are estimated as just 2.3 billion US annually, a drop compared to the cost of a single global health crisis. And even more striking, every dollar invested in animal health can generate return up to 86%, according to the World Bank. Thus, a paradigm shift is needed. Prevention should not be seen as a burdening cost, but as one of the most strategic and the smartest investment for global health security. Excellencies, today's discussion has made very clear that infectious health threats often emerge at the human-animal health interface. But by reinforcing our first line of defense, we are able to detect threats early, prevent their spread, and prevent local outbreaks from becoming global crises. In doing so, we protect economies, saving human lives and ecosystems. And this is why we must move, and that's what we are doing today, from reaction to prevention and from silos to integrated systems. The One Health approach provides us with the framework to do exactly that. And I would like to share with you today some concrete initiatives on prevention, surveillance, and preparedness we are committed to advance, and it's a commitment in a One Health approach. First, on prevention at source. Let's start with a very powerful example, which is rabies. Rabies is a demonstration that investing in animal health directly saves human lives. It shows that prevention works and that it delivers concrete, measurable public health outcomes. It is, you know it, a fatal disease, but entirely preventable through dog vaccination, timely post-exposure prophylaxis, and community awareness. But today, rabies still exists in more than 150 countries and continue to claim more than 60,000 deaths every year, mostly children and mostly in low and middle-income countries, a number which is largely underestimated. We know how to eliminate rabies. We have the tools. We have the tools, and we have demonstrated we can do it. So let's make a commitment today and use this example not only as a disease control program, but as a model for One Health in action, an indicator of success. And let's save children by vaccinating dogs, while building wall of government One Health systems for future threats. This is one of our concrete proposals. Second, on surveillance. Prevention depends on our ability to detect and monitor pathogens across human, animal, and environment. This includes also wildlife, essential to anticipate emerging threats. At WOA, we ensure global transparency through our notification system on listed disease, which provide critical real-time information to all. But we must go further. And we will launch Wild EPI, a real-time wildlife health information system. And in line with the One Health Data Conversion Declaration of Intent, all our data will be shared with partners for integrated surveillance systems. Third, preparedness. Remember, during COVID-19 pandemic, veterinary services played a critical role, notably by supporting human testing through veterinary laboratories. Though in many countries, we faced multiple barriers before that collaboration could become effective. Building on this experience, we decided we want to advance on a structured framework called Beyond Silo to support the integration of veterinary services into national preparedness and response mechanisms to natural, accidental, or even intentional biothreats. I have a hope when I was listening to all this investment. Let's share resources. Let's raise awareness of donors, investors, and private sector. When you invest, when you innovate, think One Health, think human, but also think animal. In sharing equipment, we spoke about genetic sequencing. In access to vaccine, to diagnostics, and in scaling of innovation. In closing, I would like to reaffirm the support of WOA as part of the quadripartite to members for adapting our collective response to evolving threats. And the increasing spread of avian influenza, which can be maybe the potential tomorrow pandemic, across species and regions, including spillover into mammals, illustrate how quickly biological risk can evolve. And in response, we are advancing a quadripartite strategic framework on avian influenza to strengthen coordination, enhance surveillance and risk assessment, and reinforce response capacities across sectors and borders. We are also launching a new joint working group with PRESOD to strengthen the translation of science into policy and action, particularly on prevention. And because effective One Health systems rely primarily on people, we have advanced with FAO and WHO on a joint One Health learning task force to improve workforce capacities, because effective systems depend on skilled professionals able to work across disciplines, make informed decisions, and build trust. And we rely on our respective collaborating center in One Health, Hillary for us, and in training. And I would like to say just a word and thank VetaGroSup here in Lyon, which is one of our collaborating centers. Excellencies, one message to go back with. Health security begins with prevention, and prevention begins with One Health. We have the knowledge, we have the tools, we have the partnerships. What we need now is to scale up investment, integration, and political commitment in a true One Health spirit. This is a necessity, and this summit and your commitments give hope to the animal health sectors. Thank you very much.
Merci, Madame la Directrice Générale, à vous et à l'OMSA, l'agence internationale centenaire basée à Paris, de rappeler ce lien essentiel entre la santé humaine et la santé animale qui est vraiment, vous l'avez compris, au cœur de l'approche One Health. Je voudrais aussi que nous applaudissions Madame Emma Ross et l'ensemble de nos panélistes en les remerciant pour ces discussions. Merci. Thank you very much. Thank you. Thank you. Thank you. Merci à vous. Merci, Monsieur Mérier. Merci infiniment. Merci. Thank you. Yes, please. Donc maintenant, nous avons entendu deux panels extrêmement intéressants. Nous avons entendu les scientifiques. Nous avons aussi eu les responsables de collectivités territoriales. Je vous invite à écouter attentivement un message de la société civile qui nous sont partagés par Madame Runa Khan, fondatrice et directrice exécutive de l'association Friendship. Over to her.
Between the pandemic crisis, climate disruption, and deepening inequality, humanity faces a global wake-up call, being forced to question our relationship with one another, with nature, with life itself. This is why One Health matters. It's a path towards a fairer, safer, and a more hopeful world. We must reinforce solidarity, regain trust in science, respect the knowledge of communities living these realities, invest far more in prevention and preparedness, understand planetary boundaries, share and scale the invaluable initiatives that has remained too often isolated, overlooked. Above all, we must break the silos, ensure fair distribution of resources, and bring together public institutions and private actors. We must act now. As founder of Friendship, 23 years of serving 7.5 million people annually in some of the most underserved communities, I have learned that sustainable results cannot happen without solidarity and mutual respect. This led to a group of us creating One Sustainable Health Forum in 2020. A unique global platform bringing together diverse voices, linking planetary health, justice, and sustainable development. I am proud to be the honorary chair since its inception. With the support of One Sustainable Health, its partners share best practices, learn together, and create meaningful opportunities and solutions across countries and communities. On this 7th April, with the support of the Government of France, alongside national and international organizations, governments, civil society, we appeal to all citizens to embrace the importance of a holistic One Health approach to bring better health, opportunity, dignity, and hope for all life and our planet.
So you just heard it from Ms. Can. We must act now, and everyone can act. This holistic approach is actually something that everyone should be talking about. We will now move to the third and last panel of the day. It is the last panel, but it is a very important one. So I want to thank all of you that have stayed, and I welcome all of you that are coming back. Actually, this panel will talk about something very important, something that we have to talk about, being here in Lyon, la capitale de la gastronomie. Nous allons parler de ce que nous mangeons, de nos systèmes alimentaires, de comment travailler pour une alimentation saine et durable. Nous allons ensuite évoquer les conséquences des pollutions sur la santé humaine, les équilibres écologiques. Chaque année, mesdames et messieurs, ce sont 12 millions de décès qui sont attribuables à des facteurs environnementaux. Ce chiffre, en fait, devrait être présent dans toutes nos têtes. C'est vraiment insupportable. 12 millions de décès. So without further ado, I will now invite the moderator of this panel. It's Professor Carlos Daneve, a strong advocate of One Health, as co-chair of the One Health High-Level Panel and chief scientist of the European Food Safety Agency. I have to tell you, yes, please, you can applaud him. Please, Dr. Daneve. Before I hand it over to him, I have to tell you a secret that Mr. Daneve told me yesterday. He told me that for 20 years now, the scientist community had been waiting for a moment when we can all act and talk together. So now is the time.
Thank you very
Professor.
much. Merci, Madame Ministre. Mesdames et Messieurs, Excellences, ladies and gentlemen, and all of you One Health fans, advocates, believers, curious, sitting here in the room or wherever you are connecting around the world. Again, a word of thanks. Indeed, for many of us scientists, we've been 20 years waiting for this rendezvous between scientists and top politicians, and it's been a great journey so far. But on this third panel, indeed, we want to take the journey a little bit further. As the Minister has mentioned, we have this planet that we need to take care of, and despite the best efforts of our astronauts, it's still really the only one we have. And our health is inextricably connected to the health of this planet. That provides for us everything we need. But it's also a planet that is under threat. So we propose that in this last panel, we take a quick but an essential deep dive into these special momentums. We reaffirm the political will that this approach can make action a reality. And then we talk how we can make it work in food and nutrition, but also in pollution. And without further ado, I ask you to help me to welcome our panelists to the stage. And the first one, will be Son Excellence Rachid Talbi El Alami, Président de la Chambre de représentants et représentant de Sa Majesté le Roi Mohamed VI, Roi du Royaume de Maroc. Excellence. Then also His Excellency Ahmed bin Ali Al Sayed, Minister of Health and Prevention of the United Arab Emirates, representing the Presidents of the UAE, Sheikh Mohammed bin Zayed. Also, Mrs. Ingrid Anderson, Under-Secretary General of the United Nations and Executive Director of the United Nations Environment Programme. Monsieur Antoine Bernard de Centrafrique, directeur général de Danone. And last but not least, Mr. Matt Reed, CEO of the Aga Khan Foundation. Welcome all. And without further delay, we go to work, and I invite Mr. President to take the podium. Thank you.
Madame la Ministre, Excellency, Mr. the President of the French Republic, first of all, I'd like to warmly thank His Excellency, the President of the French Republic, for organizing this summit and for his strong commitment to the major issues that bring us once again together today. It's a great honor for me to speak today in the name of His Majesty the King Mohammed VI and on behalf of the Kingdom of Morocco at this One Health Summit. Allow me also to convey the greetings of His Majesty, as well as his steadfast commitment to the causes we are addressing today and their results and resolutions. A summit that reminds us of a simple truth. We have only one planet, and we share one common destiny. So we need one action for one health. Ladies and gentlemen, the theme of One Health is not just a slogan. One Summit is not just a meeting. It's a warning, because today, human health, animals' health, food production process, the health of our planet, and the balance of all living systems are one and the same. And yet, we continue to act if they were separate. The climate is changing, ecosystems are weakening, inequalities are deepening, crises are multiplying, and in response, too often, our actions remain too slow. Our actions are dispersed and sometimes insufficient. Humanity has always faced challenges, but today, these threats are converging in ways that endanger our shared future. Climate disruption is no longer a distant risk, it's a reality. It increases vulnerability, threatens biodiversity, and destabilizes our societies. At the same time, uncontrolled urbanization, unbalanced food systems, and harmful practices are affecting both physical and mental health. So let us ask ourselves a simple question: how much longer can we afford to wait? So allow me to speak about Africa. First of all, Morocco supports Ghana's initiative and believes in His Excellency's President's capacities to fulfill this commitment. Africa is a continent that is exposed to the effects of climate change. Many pandemics, the COVID-19 was a stark reminder. And international solidarity has demonstrated its limits. And this, we can no longer accept it. Morocco, under the leadership of His Majesty the King, Mohammed VI, has made a clear choice, the choice of action, action for health, action for climate, action for green fertilizers, action for Africa. Through concrete initiatives such as the 3A initiative for the adaptation of African agriculture, when Ebola pandemic struck some African countries. Morocco kept its air connection, and through a profound reform of our health system as part of broader vision of a social state. Ladies and gentlemen, in an interconnected world, isolation is an illusion. No country, I repeat, no country can face these challenges alone. No agency and no ministry alone can act against illness, pandemics, etc. We must share knowledge, build capacities, transfer technology, invest together, and why not go further? Let us consider an ambitious plan for health in Africa in the spirit of one health system, because ultimately everything depends on one thing: political will. Ladies and gentlemen, the pandemic taught us one essential lesson: our destinies are interconnected, and in the face of global challenges, individual solutions are nothing but an illusion. So today, we are faced with a choice: to endure or to act. Morocco has chosen to act and has already broken the borders. Thank you for your attention.
Thank you very much. And without further delay, I now pass the floor also to an intervention by the United Arab Emirates. Your Excellency.
Your Excellencies, distinguished colleagues, I am honored to address you today on behalf of His Highness Sheikh Mohammed bin Zayed Al Nahyan, President of the United Arab Emirates. We extend our sincere appreciation to the government of the French Republic and to President Macron for convening this very important summit at a critical moment for global health. We also recognize the leadership of the quadripartite, the WHO, the UNEP, FAO, and WOAH, for advancing the One Health agenda with great ambition. The One Health approach reminds us of a simple truth: the health of people, animals, and our environment are inseparable, and that these risks are inherently interconnected, with pressures on one system quickly affecting the others. Today in the UAE, we are seeing this play out in real time as illegal, unjustifiable, and unprovoked attacks from Iran, encompassing over 2,700 drones and missiles, continue to exact a toll on human lives and livelihoods, critical civilian infrastructure, and the environment simultaneously. The UAE condemns in the strongest terms these attacks on our territory, the Gulf states, and the wider region. In just the first 2 weeks of this war, over 5 million tons of CO2 emissions were generated. This is equivalent to the combined yearly emissions of the world's 84 lowest emitting countries. Strikes on fuel storage sites alone have burned up to 5.9 million barrels of oil, adding nearly 1.9 million tons of CO2 equivalent emissions to a world already racing against a shrinking carbon budget. The hostile closure of the Strait of Hormuz also has dire and lasting consequences for human health, biodiversity, and food systems. The extra transit time of vessels rerouted around the Cape of Good Hope has increased emissions and delayed products like medicines from reaching those who need them. Around 35% of the world's fertilizers flow through the strait, and the threat to global agriculture is monumental. If the strait remains closed, 45 million people risk being pushed into food insecurity. This is a war against the health of every country, consumer, and family that depends on affordable energy and food, against ecosystems that are being damaged, and against critical resources that we all share. It highlights the extent to which our systems are interconnected and the importance of addressing risks with that shared reality in mind. While One Health has historically centered on zoonotic diseases, our experiences show that we must continue to expand the boundaries of One Health while addressing environmental risks such as air pollution, which are major drivers of chronic diseases, including cancer, cardiovascular, and respiratory issues, and pregnancy complications. From this experience, we drew 3 lessons that we believe are broadly relevant to our discussions here. First, the importance of integrated policy and governance, recognizing that health, environment, and food systems are deeply interconnected. Second, the need for science-based decision-making, supported by strong data systems that translate evidence into action. Third, a shift toward prevention, not only response, but by addressing risks before they become crisis, including through early warning systems and risk-informed planning, many of which are reflected in the outcomes and deliverables of One Health Summit. In this context, we also underline the critical importance of the water-health-climate nexus, particularly in regions facing water stress, and look forward to advancing these priorities through the 2026 United Nations Water Conference, which the UAE will co-host with Senegal. At a time when cooperation between nations is under strain, the protection of human health through a One Health approach must be a point of convergence. On this World Health Day, the United Arab Emirates is pleased to endorse the One Health and Beyond Declaration and partner with the One Health Center of Excellence Global Network with a view to convene UAE academic institutions as a concrete step toward that goal. The UAE remains committed to continue advancing practical, implementation-focused solutions that integrate health, environment, and climate priorities. Thank you very much.
Thank you, Mr. President. Thank you, Minister. I think both your speeches have highlighted the need for connecting the dots, connecting our silos. And we move, therefore, already immediately to one of these, as already mentioned by the Minister, and being the Chief Scientist of EFSA, one of my favorite topics, foods, probably the favorite topic to many already in the room. And I turn to you, Antoine, Director, CEO of Danone, to start this dialogue. I know health and nutrition is a long-standing value at the core of Danone, and I would like to ask you to put your One Health lens here at the summit today and tell us, how do you see nutrition and food systems helping us, to bend this curve of non-communicable diseases?
Well, thank you, Carlos. Before answering precisely your question, I'll indulge to two very quick remarks. I mean, the first one is thanking you and the organizer for having business around the table, because I believe business can help and have impact at scale, and we urgently need impact at scale. The second thing is you mentioned our long-standing commitment. Danone is born as a company from the belief that you can provide health through foods to many people, do that anchored into science, and that health is inseparable from planet, to the point where the signature of Danone for many, many years has been one planet, one health. So to your question, three very practical things. I mean, the first thing is non-communicable disease don't start in hospital. When it's in hospital, it's too late. I mean, you can treat them, we can help with medical nutrition, but they start upstream. Prevention start upstream much earlier through the habits, through proper nutrition, through proper diet, through a real scientific and structured approach to nutrition, to be able to, over time, provide the right nutrient with the right diet in the right form and with the right habits. I think the second point, and I was alluding to it, is you cannot separate food or diet from food systems. There is no healthy food without a healthy nature. That's why we at Danone have been advocating for a long time and are being involved into regenerative agriculture at scale. I mean, 40% of all the product we sell today are coming from farms that have started their transition to regenerative agriculture, because in the end, there is no healthy diet without a healthy planet and healthy food system. The third point probably is, as I was saying, business has a specific role to play. By setting targets, by measuring progress in a structured way, by leading or creating coalitions that cut across the entire ecosystem, from NGOs to government. But what business is good at is setting goals, measuring, improving, delivering.
Thank you very much. And you just want to challenge you. I just think it's starting to work. Just want to challenge you a little bit further, because I know you're also been very focused on we need action, measurable action on the grounds. And I know your special interest and passion also for early childhood problems. And you've mentioned before already the issue of anemia and iron deficiency. And I know you're willing to go further there. So this is your pitch. This is the pitch. Well, listen, let me frame the pitch. I mean, according to the WHO, there is an estimation that about 40% of all kids between 6 months and 5 years suffer from anemia. And lots of it, by the way, are coming from deficiency in iron. It's a drama. It's a drama because it's a silent disease. It's a drama because it is the future of humanity. It's our kids. It's a drama because we can do something about it. And we'll try to do our part at scale, as we discussed. So between now and 2030, we are committed to support 14 million screenings for iron status and for anemia, with very, very clear intent, which is making it visible, identifying the children that are at risk, generating data, because when you have data, you can act, but also strengthening awareness amongst the families, amongst healthcare professionals, amongst public authorities, because anemia is a very, very silent disease that conditions the future of our kids. And to make it very, very real, we'll do it in three different ways. One is embed screening into existing health system workflow, not doing something parallel. Otherwise, it's a waste of money and it will not work. The second thing is do it in a way that is non-invasive. So not taking blood, but doing it in a way that is modern, doing a way that is non-invasive, using AI to be able to do it at a very, very large scale
and at a very, very, very low cost to then have the data and turn people to a healthcare provider. And the third point is when you have the data, when you know what's happening, obviously supporting prevention through nutrition informed by science. Because once again, it needs to be informed by science. So 14 million is a lot, but 14 million is very, very little in the big scheme of things. So my call to action is also, well, this requires partnership. This requires our businesses, NGOs, our public authorities to join forces and move against a silent disease, which is conditioning the future of our kids.
Thank you very much. I now turn to you, Matt, and to the Aga Khan Foundation. I mean, I'm also aware of your long-standing work in food systems and nutrition, and the same challenge. With this One Health lens, how do you see the work of the foundation moving forward?
Thank you very much, and thank you to everyone for coming today. There's a lot of complementarity between the two of us, and hopefully we won't repeat each other too much. But I guess let me start by saying that the Aga Khan Development Network has an intergenerational commitment to many of the One Health principles. So if you think about the vision of His late Highness the Aga Khan IV, for over 60 years, he led our combined 10 agencies on economic, social, cultural development. Now his son, His Highness the Aga Khan V, has taken the mantle. And if you think about the way that our system is structured, for example, we work in about 1,000 hospitals and clinics. We have what we think of as an integrated health program from the community level to primary, secondary, tertiary, including health workforce training. A very important through line is maternal and child health, especially focusing on those early years, and doing that in partnership, public-private partnership with governments. However, the edifice on which, as you just said, the edifice on which good health is built is on nutrition and healthy food systems. And so we have large programs looking at how to make food systems more nutritious, how to help smallholder farmers, in particular in the rural areas where we work, use regenerative methods. We work with about 1 million farmers every year who help provide better food and food security for about 8 million people every year. But because of that commitment to nutrition and more nutritious food systems, His Highness last year at the Nutrition for Growth Summit made a commitment of $45 million to that integrated nutrition work. And this year, in solidarity with the Prime Minister and the Prime Minister of the UAE and ruler of Dubai's call for an Edge of Life campaign during Ramadan against malnutrition globally, His Highness has doubled that commitment to $100 million over the next 5 years, again for this integrated nutrition work, building as well on ongoing investments in health, agriculture, and regenerative agriculture.
Thank you very much. Thank you very much to both of you. I'm also concise at time. I would like to ask you to return to your seats as we shift gears a little bit and move to another topic in this session. And for that, I would like to call to the stage our last two panelists. No, you can stay, please. We're just welcoming two more guests. And the first one will be Miss Natalia de Miranda Grilli. She's a PhD candidate at the University of Tasmania, but a member also of the steering committee of the Scientists' Coalition for an Effective Plastic Treaty. And then, Monsieur Simon Bernard, président et cofondateur du Plastic Odyssey. Thank you very much for joining us. So now we go from food to pollution. topics that are also very often interlinked. But first with you, Natalia, and of course we are very interested to know how is the work of the coalition moving forward, and how do you see the needed actions to take us forward on this topic of plastics?
Thanks, Carlos. Good afternoon, Excellencies, ladies and gentlemen. I am honored to represent the Science Coalition for an Effective Plastics Treaty here today. The Science Coalition is a network of nearly 500 independent scientists from more than 70 countries working on plastics across a different range of disciplines and geographic perspectives. Today we launched a Science Coalition declaration on One Health impacts of plastics, which I'll be summarizing here today, but I invite you all to access the full declaration using the QR code that is on screen right now. Ladies and gentlemen, decades of scientific research demonstrate that plastic poses a multiple, interlinked, and cascading threats to human, animal, and ecosystem health at the heart of One Health concept. And plastic pollution goes beyond just plastic waste. It happens across the entire life cycle of plastics, from production to disposal, including the use phase of plastic products. It comprises both large items as well as small particles called micro and nanoplastics, as well as plastic chemicals. Plastics contribute to air, water, and land pollution, threatening the safety of our food systems and entering our bodies. The global health and economic impacts of plastic pollution are very substantial, but is still underestimated. Global health impacts on humans include increased risk of non-communicable diseases such as cancer, neuropsychiatric disorders, cardiovascular, respiratory, digestive diseases, as well as metabolism disruption. And very similar effects can be observed in animals. And very important, plastic pollution is everywhere, but it doesn't affect everyone the same. It exacerbates social and geographic inequalities and disproportionately affects already vulnerable populations, such as women, children and youth, frontline and fence-line communities, indigenous peoples, local communities, and population and low-income countries and communities. Economic costs resulting from human health impacts include increased healthcare costs, productivity losses, reduced life expectancies, diminished quality of life. An estimate of the global health costs related with a number plastic chemicals was found to be around $1.5 trillion in 2015. And as this estimate was based only on a small subset of plastic chemicals and health outcomes, the true global health burden of plastics must be much higher. We are now facing an historic opportunity to build a global institutional framework to guide us towards a safer and more sustainable economy for plastics, and science-based evidence can help us to get there. To protect human, animal, and environmental health, there is an urgent need to adopt an effective global plastics treaty to end plastic pollution across the entire life cycle of plastics, as mandated by UN Resolution 514. As was mentioning many times at the scientific summit yesterday and also today, working on prevention and at the source of the problem is highly recommended. And in this sense, reducing plastic production and consumption is demonstrated to be the most effective mean and economically viable lever to reverse the current unsustainable patterns of production and consumption of plastics. And this is particularly relevant given that the world is already struggling to manage all the plastic waste from the current levels, and that plastic production is expected to triple by 2060. Additionally, reducing plastic production would strengthen circular economy, create favorable markets for more sustainable initiatives and products, and generate local, social, and economic opportunities for all. Investing in solutions such as expanding repair and non-plastic reuse systems and diversifying material strategy in all economic sectors reduces single-use plastics and harmful emissions and impacts. Reducing plastic chemicals and eliminating chemicals of concern is crucial to fostering a safer and more effective circular economy for plastics. And to be efficient, all these measures should be guided by evidence-based criteria defined by independent science that should aim at just and equitable transition. In conclusion, ladies and gentlemen, The One Health approach provides an effective concept to understanding of the multiple impacts plastic pollution poses to human, animal, and environmental health, and to drive us towards a safer, healthier, and more equitable future. Ladies and gentlemen, let science be our compass to go on to this journey. Thank you.
Thank you very much, Natalia, for your statements and for the commitment of so many scientists across the planet. We stay on the same topic, but perhaps if I can say we leave the lab and move into the fields. And with you, Simon, I think many of us have seen the videos. Perhaps many people here want to get on board. So I'll let you take us on this journey now.
Thank you very much. Merci beaucoup. Je m'appelle Simon Bernard, je suis explorateur et entrepreneur et je reviens d'une expédition avec toute une équipe autour du monde pendant 3 ans et demi à la recherche des meilleures solutions concrètes pour lutter contre cette pollution plastique. On a embarqué sur ce navire laboratoire qui a été transformé alors à l'avant pour travailler sur des solutions concrètes pour réduire l'usage du plastique et aller les découvrir dans le monde entier. On a parcouru 45 escales en 3 ans et demi en Afrique, en Amérique du Sud et en Asie. Et la bonne nouvelle, c'est qu'il y a des tonnes de solutions qui existent déjà partout dans le monde pour réduire l'usage du plastique, lutter contre cette pollution plastique. Et donc, on en a référencé plus de 200, on a accompagné des entrepreneurs pour les répliquer à grande échelle, pour stopper vraiment cette pollution à la source. Alors, je vais passer rapidement sur ça, puisque ce que je voulais vous raconter aujourd'hui, c'est un autre phénomène qu'on a découvert en parallèle de toutes ces solutions qui permettent d'éviter que le plastique arrive dans la mer. C'était ça l'objectif de cette première expédition. Comment est-ce qu'on fait en sorte concrètement d'arrêter d'utiliser du plastique et de ne pas jeter du plastique dans la mer? Mais on s'est rendu compte qu'il y a quand même énormément de plastique qui s'échoue sur des côtes qui sont très protégées, notamment les côtes des sites du patrimoine mondial de l'UNESCO. Alors, je vais vous donner un exemple qui m'a marqué, puisqu'en 2024, on a fait escale sur l'île d'Henderson, au milieu du Pacifique, à peu près à une semaine de navigation de la Polynésie et de l'île de Pâques. Et on s'est rendu compte que ce joyau de la biodiversité, qui compte parmi les 50 sites les plus protégés de la planète, accueille des espèces endémiques incroyables. Au total, tous ces sites représentent 15% de la biodiversité mondiale. On se rend compte que ce site était aussi malheureusement connu pour sa pollution plastique. Pour vous donner un chiffre, sur les côtes d'Henderson, on retrouve entre 200 et 400 fois plus de plastique en termes de densité qu'au milieu du continent de déchets, qu'on a appelé continent de déchets au milieu du Pacifique. Donc il y a énormément de plastique qui s'accumule, qui se dégrade et derrière qui impacte la biodiversité. Un exemple très concret, par exemple, les tortues. Quand on ajoute des microparticules dans le sable, on va changer la température des nids de tortues et donc on va changer le sexe des tortues puisque le sexe des tortues dépend de la température. Donc il y a des impacts très concrets. Et c'est pour ça qu'il y a une vraie urgence à aller retirer ces déchets avant qu'il soit trop tard, avant qu'ils se dégradent en particules. Alors la difficulté, c'est que ces endroits-là sont très protégés, il n'y a pas d'humains qui vivent, ils sont difficiles d'accès. Notamment Henderson était connue pour être impossible à nettoyer, puisqu'elle est entourée par cette barrière de corail que vous pouvez voir. Et donc on a inventé des techniques plus ou moins farfelus, mais qui nous ont permis d'extraire 10 tonnes, donc les 10 tonnes de déchets plastiques de cette île que personne n'avait réussi jusqu'alors à nettoyer, en utilisant notamment des parachutes ascensionnels pour faire voler les déchets au-dessus de la barrière de corail, des plateformes flottantes. Et on s'est rendu compte qu'en une semaine, avec 10 personnes, on avait réussi à nettoyer un des sites les plus importants de l'humanité, avec très peu de moyens. Alors on est reparti, merci. On est reparti en se disant pourquoi pas aller faire les autres, puisqu'il n'y en a que 50 dans le monde, que ça représente que 1% de la surface terrestre, donc c'est quand même assez accessible. Et c'est 15% de la biodiversité marine, comme je vous le disais, mais c'est aussi 35% des espèces marines en danger d'extinction. Alors on s'est rapproché de l'UNESCO, on a signé un partenariat pendant l'UNOC à Nice avec l'UNESCO. Et puis on a reçu aussi la visite du président Macron sur notre bateau à l'île Maurice qui a soutenu ce nouveau projet. Donc je suis fier aujourd'hui d'annoncer le lancement d'un nouveau navire, un voilier de 60 mètres à propulsion vélique et qui sera dédié à la restauration et à la protection des sites les plus importants de la planète. L'idée avec ce navire, c'est de pouvoir donc, lancer un premier prototype et puis derrière avoir une flotte sur chaque océan qui va être en charge d'étudier, faire de la science, avec notamment l'IRD qui nous suit aussi, de la restauration, donc concrètement aller retirer ce plastique, mais aussi potentiellement les espèces invasives, ou la restauration des coraux, des mangroves, et puis derrière, des plaidoyers mondiaux pour réduire à la source la quantité de plastique et puis globalement les pollutions. Donc très fier d'annoncer aujourd'hui le lancement de ce nouveau navire prochainement. Merci.
Merci. Ladies and gentlemen, thank you to all the panelists who have already addressed us. This is also my quick minute of short reflection of what we've heard here today. And very quick 3 bullet points. First one, picking up on what you've said here. We need strong commitment. It makes sense even in the face of dramatic adversities. And then from our food and from our pollution colleagues, these silos need to be bridged. They need to be connected, and they are part of an approach that really needs to look to all the dots. Second quick bullet point, I think you're all deserving a huge applause later on, not now, to say we have probably broken also the Guinness record for quickest science to action translation. Yesterday in this room, hundreds of scientists came together. Now we published the recommendations. They are still hot from the press. And we had the Tuesday since the morning until now, including now, of ticking the box, science recommendations, turning to action. And last, because the ambassador was kind enough, the minister was kind enough to introduce me as a believer in One Health, I just want to share with you a sentence, not mine, that I profoundly believe embodies the spirit of One Health. And I was privileged to listen to Pope Leo XIV when he addressed the Food and Agriculture Organization at its 80th anniversary. And he said, at an historic moment marked by deep divisions and contradictions, to feel united by the bond of collaboration, it's not just a beautiful ideal, but a decisive call to action. We must not be content with filling walls with large, eye-catching posters. The time has come to make a renewed commitment that will have a positive impact on the lives of those who expect tangible action from us. And with that, I give the floor to an organization that really is the guardian of our planet health. Madam Executive Director, the floor is yours.
Thank you very much, and what a distinguished panel. And I think that this session has been very, very interesting, but let me start by giving thanks to France, of course to President Macron, but also to the dear colleagues who are part of the quadripartite, I see Tedros here, for really making this work. Because this panel invited us to expand the boundaries of One Health. It invited us to look beyond the sort of normal. It invited us to talk about what the presidents of both Botswana and Ghana spoke about this morning, the health of humans, the health of domesticated animals, the health of wild animals, and the health of our planet as we know it. And the health of our biodiversity, that on which we stand, that which feeds us, that which gives us our water and our lives as we know it. We stand or fall on nature, on planet Earth, and that is what we have to understand. We are sharing this Earth with other species, and when they are in a bad way, so are we. And that's what this panel has essentially told us. Because too often, I'm sorry to say, the One Health focuses on, yes, infectious diseases, which are important, as we heard from Emmanuel, but we also need to make sure that we go beyond, and that's what this panel has done. But we also, I put it to you, need to understand that this cannot be just a human-centric conversation, because we are sharing this planet with another 8 million species. And these species, we are as dependent on them as they are on us. And frankly, if we were to disappear, they would probably be just fine. And so the thing is that we are more dependent on them than they are on us. But the issue that we have to understand that we have been rather careless with the earth. We've degraded it quite a lot, and that is now coming back to us in the form of these invoices that now we are struggling to understand. Invoices that come to us in the form of climate change, of fires, of droughts, of floods, of zoonotic diseases, or of desertification and lands that are no longer fertile, or of our waters being polluted. Now, in 2022, the United Nations General Assembly came together and member states said that there is a universal human right to a clean, healthy, and sustainable environment. That is now a right. And that was then picked up later on by the Assembly, which I am honored to be guided by, the United Nations Environment Assembly, that began to say, okay, so how does this all work in terms of nature-based solutions? And of course, when we gavelled the Kunming-Montreal Global Biodiversity Framework, which is the Paris Agreement equivalent to the Biodiversity Convention, it was very clear that human health was sewn right in, baked right in to these elements, because you have to understand biodiversity in human health, nature and human health. And I was very happy to see COP26 in 2021, where health really gained a lift, a good lift, and where we saw WHO being present, and where we saw resilient health systems and a greater recognition of the co-benefits of climate action and health benefits. In UNEP, my organization, we speak about a triple planetary crisis. The crisis of climate change, which I think everyone has understood, the crisis of biodiversity loss, land degradation, desertification, water issues. That crisis is the second crisis. And the third crisis deals with the pollution crisis. And we must not, when we speak about One Health, only speak about pollution. If we do so, we are missing the point. Because the desertification, the droughts, the sand and dust storms have impacts on childhood asthma just as much as does pollution, and in places more. So we must understand that yes, climate, yes, all the things that have to do with our terrestrial and maritime ecology, and yes, indeed, pollution. But a few words on pollution, because we need to understand that our own careless interaction with the planet, our emissions from fossil fuels, our chemical pollution, are causing respiratory diseases, are causing cardiovascular conditions, are causing pollutions, are also causing strokes and lung cancers. And we heard some elements from my colleague here. It's important, Lancet in 2022 published and spoke to tackling pollution could help reduce by 9 million premature deaths each year. And of course, we understand that AMR is an important dimension also in the environment. Let's not focus only on over antibiotic use in human and in our domesticated animals. Let's understand how are we running our pharmaceutical factories? What happens to the effluents? What do we do with our agricultural runoff? What happens in our health sectors? How do we deal with bio-waste? And what are we doing with antivirals, antifungals, and antiparasitics that we at times are spraying on our fields? This is all part of the AMR story. So let's broaden out when we speak about non-communicable diseases. Let's make sure that we educate health professionals, because it is not enough anymore just to understand the health side. You've got to understand the nature side too. How do we integrate ecological health into health practice? We know today that there are doctors who are well informed, who understand that diabetes, stress, cardiovascular, Sometimes the best medicine to give is RX nature. Take a walk, get moving, and preferably move in nature. It'll bring down your blood pressure. You may be able to manage your diabetes, and you will most certainly lower your stress levels. Of course, food systems, other colleagues have spoken to, so I'm not going to do that, but it is critical that we are well nourished, both to be healthy and to be resilient. But that food system cannot be that which poisons us. So let's ensure that our food system is nature positive. And water, others have spoken to it, and I really salute the UAE for hosting the next water conference. We look forward to that. Let's make sure we speak about water supply and sanitation. But please let us also talk about big water, the big hydrological cycle, because it is fed by nature. Nature sweats it out, it comes down as rain, and if we do not take care of our rainforests and our tropical forests, we will lose this. So of course, and finally, we need to think about nature as medicine. I mentioned the issue of walks in nature. We also need to understand that 80% or so of modern medicine actually comes from nature, from plants and from things that nature can teach us, or inspired by nature, nature mimicking. This is very important, and that's part of why we need to make sure we protect, of course, that nature. But nature does other things too. There is a landmark MRI study on nature and neurodevelopment, which looked at differences in brain volume by residential exposure to greenness. It's from 2018. It looked at children from 7 to 9 years old. It found greater amount of gray matter volume and greater amount of white matter volume in the brain regions linked to better cognitive performance, suggesting that regular exposure to natural environments supports a healthy brain development. This is not for the faint-hearted. And of course, this is not really a surprise. You take a tiger cub and you put them in a concrete zoo cage, or you leave them in the wild and open. Which one do you think develops the best brain? We know this from nature. How do we not understand this for our own kids? So the message has to be very simple. We must acknowledge that a healthier planet means healthier people. And preventing environmental degradation could prevent premature deaths, reduce the global burden of disease, and ease pressure on health system. From UNEP, my organization, I take this opportunity to affirm our commitment to support countries in integrating biodiversity health linkages into the 70 countries that we have the privilege of being supportive of as they prepare their national biodiversity strategies and action plans. That's equivalent to the NDCs for those of you who only speak climate. But these plans are very important. We will work to lift the One Health dimension. I also want to affirm our commitment to strengthen our work on wastewater and environmental surveillance. We do a lot of that surveillance in priority countries in Africa to enhance capacities to detect health and environmental related risks. Bottom line is the quadripartite, the One Health Joint Action Plan. That's our map. That's what we have to do. And holistic and collaborative solutions, that's the way we will get there. If we only park this with the environment ministers, we will have done them an injustice. And we heard from these two distinguished representatives, ministers, how they speak to the nature dimensions so powerfully. So let us not walk away from here and think that this One Health is a little check for the environment. No, it is the earth on which we stand. It is the food that we eat. It is a nurture for our children. It is the health of our future. And we know that if we not take care of that, then we are not taking care of ourselves, let alone our children or our children's children. Thank you.
Merci à tous. Can you hear me? Oh, here it goes. Please join me in applauding this wonderful panel. Thank you, Excellency. Thank you, thank you. Muito obrigada.
Muito obrigado.
Muito obrigada. Obrigada. Ciao, ciao. So, merci à tous d'avoir rappelé notre responsabilité partagée face à ces enjeux qui engagent notre avenir. Car si nous avons le devoir de préserver l'environnement, c'est avant tout pour la santé de toutes et de tous et des futures générations, la nôtre, la vôtre, mais surtout celle de nos enfants et des générations qui viendront après. Nous allons donc passer la parole aux jeunes. Ils nous ont interpellés hier. Oui, vous pouvez les applaudir, les jeunes. Merci. C'est surtout pour eux qu'on est ici. Et je vous propose de les regarder dans une petite vidéo.
Les jeunes représentent l'avenir. C'est ce qu'on dit, n'est-ce pas? Mais cet avenir, nous, les jeunes, nous le construisons déjà, ici et maintenant, dans les villes et les campagnes, dans les écoles, dans les universités, les associations, les laboratoires. Nous agissons chaque jour pour un futur durable.
La santé des écosystèmes, celle du monde animal et celle des sociétés humaines sont indissociables. L'approche One Health, ce n'est pas l'affaire de quelques experts. Elle exige une action collective à laquelle nous, les jeunes, nous participons pleinement.
Notre expertise, forgée au plus près du terrain, est une ressource précieuse. Intégrez-nous aux discussions, aux négociations, aux décisions, au niveau local, national et international. Ouvrez-nous les portes de vos institutions sans discrimination. Reconnaissez la richesse de tous les savoirs, y compris les savoirs communautaires.
Pour agir durablement, nous avons d'abord besoin de moyens pérennes. Nous demandons des bourses, un volontariat indemnisé, des emplois qualifiés et justement rémunérés, un soutien à l'entrepreneuriat, des programmes de recherche et d'innovation citoyenne.
Nous soutenir, ce n'est pas un coût, c'est un investissement dans l'avenir. C'est garantir la relève des professionnels de demain, c'est garantir la continuité des engagements d'aujourd'hui. Nous appelons aussi à des pédagogies actives et concrètes, transdisciplinaires et inclusives.
Apprenons l'interdépendance en tous les êtres vivants dès la petite enfance. C'est une condition essentielle pour préserver l'environnement, prévenir les crises sanitaires et bâtir des sociétés plus justes.
Enfin, nous plaidons pour une information accessible, attractive, fondée sur la science. Une information qui ne se contente pas d'alerter, mais une information qui propose des clés pour l'action.
Avec un vrai soutien, nous serons les ambassadeurs et les ambassadrices les plus efficaces au service de politiques publiques équitables.
En ce 7 avril, nous les jeunes, nous sommes déjà engagés dans l'action. Mais seuls, nous n'irons pas loin. Alors mobilisons la force des réseaux, créons des synergies entre jeunes, scientifiques, décideurs et citoyens à la hauteur des défis que l'approche One Health exige.
Maintenant, à vous aussi de vous engager pour et avec les jeunes.
I think after listening to such a powerful message, each of us should think of how we are going to involve the youth in our reflection. So I think we're doing this for them, we're doing this for us, we're doing this for the future generations. And going from a concept, from the idea of One Health to action is precisely what we wanted to do today. Car rien n'est plus fort qu'une idée dont l'heure est enfin venue. Et on peut le voir, grâce à votre mobilisation à toutes et à tous, que cette idée, ce concept de One Health, qui vous semble peut-être une évidence, mais qui ne l'est pas pour beaucoup de personnes encore, et qui ne l'était pas il y a quelques années, est enfin en train de s'ancrer et de se concrétiser. J'aimerais vous remercier déjà d'être restés jusqu'à la fin. Ça a été une journée assez longue, assez dense, mais avec des idées très importantes, avec des annonces aussi. Et j'aimerais remercier tout particulièrement ceux qui se sont engagés à inventer des traitements de demain, à surveiller les zoonoses, à réduire l'usage des antibiotiques, des microplastiques, les aliments ultra transformés. Tout ça, ce sont des actions tangibles, des actions que certains d'entre vous, certains d'entre nous, avons la capacité de mener et nous nous y sommes engagés. Et alors, pour accompagner ces efforts, pour faire vivre l'ambition qui naît de ce sommet One Health à Lyon, nous avons besoin d'acteurs majeurs de la santé mondiale. J'ai donc le plaisir d'accueillir sur scène le directeur général de l'Organisation mondiale de la santé, Dr. Tedros. I invite you to join me on the floor.
Thank you. First of all, thank you to our moderator for leading the program effectively. No? Microphone, now. Your Excellency, President Mahama, Excellencies, Honorable Ministers, distinguished leaders, colleagues, and friends. Bonjour à toutes et à tous. Next year I will do more. First, let me express my sincere gratitude to His Excellency President Macron and the government of France for convening this important summit, and also to the President of Botswana and Prime Minister of Cambodia for honoring this One Health Summit. Their presence means the strong commitment that they have to One Health Summit. My thanks also to the Metropole of Lyon and the City of Lyon for its hospitality and welcome. And my thanks, finally, to all of the presenters and participants. You have demonstrated that One Health is not just one approach. It's the only approach. The health of humans, animals, and the environment are inextricably interwoven. We cannot protect one without protecting all three. There are so many examples: asthma and air pollution, cholera and sanitation, yellow fever, dengue, malaria and mosquitoes, Ebola and fruit bats, or rabies and dogs. We can treat and prevent all of these diseases with vaccines, therapeutics, and other countermeasures. But addressing their root cause demands a One Health approach, not as an abstract concept, but a concrete action. That's why WHO, FAO, and OIE, now OAH, formed the tripartite in 2010, which became the quadripartite in 2022 when UNEP joined us. Together, we're committed to working across sectors and across silos to protect the health of humans, animals, and the planet we all share. We're guided by the One Health Joint Plan of Action and supported by the One Health High-Level Expert Panel, or OHLEP, which provides independent scientific advice to guide collective action. I'm pleased to announce today that we are extending the current term of OHLEP until April 2027, and we're strengthening its role to better translate scientific evidence into concrete policy guidance and effective implementation. WHO is also planning to launch a new global network of One Health institutions to deliver the objectives of the One Health Joint Plan of Action, which we will invite our quadripartite partners to join. This unified network will bring together scientific institutions, research centers, and training platforms across regions and disciplines, drawn from across our agencies and the global scientific community. Its purpose is to strengthen collaboration, bringing greater coherence, coordination, and shared direction. This will be one of WHO's key priorities when we assume the chair of the quadripartite tomorrow. And I thank Dr. Chu Dongyu and FAO for their leadership over the past year. Your Excellency, President Mahama, dear colleagues and friends, as you know, today is World Health Day, marking the date on which the Constitution of the World Health Organization entered into force on the 7th of April, 1948. Or to put it in another way, today is our 78th birthday. This year, we have chosen the theme, Together for Health, Stand with Science. Science has always been at the heart of everything WHO does. Over the past 9 years, WHO has taken several steps to strengthen our focus on science as part of our transformation project. For the first time in the organization's history, we created a new science division and created a new role for chief scientist, who sits on our executive management committee. In 2024, we also had the honor of opening the WHO Academy with President Macron here in Lyon as part of the transformation. The Academy is a new institution to translate science into policy and action by equipping health and care workers, policy makers, and the WHO workforce with the skills and competencies they need to deliver health for all, especially capacity building at country level is its focus. Another way in which WHO is strengthening its focus on science is through our global network of collaborating centers. One of the functions assigned to WHO in the Constitution is to promote and conduct research in the field of health. But rather than establish its own research institutions, from the beginning, WHO's member states decided that we should leverage the expertise of institutions around the world, what we know today as WHO collaborating centers. Over the past 78 years, WHO has built a network of almost 800 collaborating centers from universities, research institutions, hospitals, and laboratories in 80 countries, the largest network of public health institutions in the world. Many of these collaborating centers work on One Health issues, such as the seasonal influenza vaccine composition, or the global antimicrobial resistance and youth surveillance system, GLASS. Starting today, WHO is hosting a global forum of WHO collaborating centers here in Lyon, bringing together experts from hundreds of collaborating centers. WHO's network of collaborating centers represent an incredible scientific asset for the world, an asset that we want to leverage to the maximum. Once again, my thanks to His Excellency, President Macron, and to the government and people of France for your hospitality in hosting the meeting. My thanks also to our quadripartite partners for your leadership and partnership. The health of humans, animals, and our environment cannot be separated, and neither can we. Together for science, together for One Health. Merci beaucoup. Thank you.
Thank you. Thank you very much, Dr. Tedros, and happy birthday to the WHO. It is indeed a very, yes, you can applaud them. It is a very, very special birthday, one that puts science at the heart of the discussions and the defense of science. All over the world, people are challenging scientific knowledge. They're comparing it to opinions, and we cannot let that happen. We need to keep listening to scientists. We need to give them a voice and translate their recommendations into public policy. This is exactly what the Republic of Ghana is doing, and we want to thank you, Mr. President, for accepting to co-host this summit and for your active implication in the defense of science and of health. I would like to give you the floor for concluding remarks, thanking you again for your presence here in Paris. Dr. Mohammed.
Thank you very much. And let me just say, distinguished participants, I think we've had a very interesting 2 days, and presentations have been excellent. On behalf of my co-chairman, I want to wrap up and thank you all for staying throughout the session. I want to thank President Macron and the organizers for the wonderful organization that has made this conference such a success. All those who participated in the discussions, the scientists, the nutritionists, the plastic activists, and everybody, we want to thank you for all that you've done. We also want to thank the city of Lyon for being such good host. It's been a beautiful spring season. And I remember a few years ago, because of climate change, even the trees used to get confused. There was a story of, the trees had gotten used to bringing the cherry blossoms at a certain time. And so they thought it was spring, and so the cherry blossoms came, and then there was a winter blast all of a sudden, and the trees were confused whether to shed the cherry blossoms or to continue to say that it was spring. But the presentations have been very interesting, and the presentation by the scientists, by the nutritionists, by the young activists working in plastic pollution. And he touched on a particularly sensitive point. We saw all that they were doing, the movie and all that, and they're doing their best, but that is a minuscule, attempt at what the scale of plastic pollution is. And plastics know no boundaries. That island he showed with all the plastics, they could have come from Africa or from, thousands of miles away. And so we need to bring that partnership together to, on a continental, on a global scale, decide what we want to do with plastics. Nutrition and physical activity. When I spoke, I talked about non-communicable diseases. In the past, in Africa, our forebears were more used to a lot of physical activity because of the occupations that they had. Today, modernization means that we're working more in offices, we have cars, we no longer walk. If you don't make a conscious decision to do some physical activity, either by walking or exercising, and you don't pay attention to your diet and nutrition, then non-communicable disease is coming. And they become a disease burden on the national health budget. And so that's why we're introducing a primary healthcare system to educate people on lifestyle changes, wellness, and all that. But there's one interesting thing. Human beings are responsible for disturbing the ecosystem. The animals are not to blame. The forests are not to blame. The waters are not to blame. It is us who are causing the imbalance in the world ecosystem. The world ecosystem was finely balanced between man and animal and plants and everything. It is the domination of the world by human beings and our population growth and our urbanization and our development paradigm that has caused the imbalance in the ecosystem. And the question we ask is, the current development paradigm where we're a mass consumption race, can the world sustain that level of development? Does the world have enough resources to maintain our lifestyles as a human race. And so for us, developing countries, we're wondering, is the Western mass consumption society our idea of development? That is a question we need to answer. Glitzy supermarkets with all kinds of mass-produced items, is that where all of us, 9 billion people, want to go? And so we cause the problem, we must find the solution. And that's why there's science and there's innovation. Our scientists must set to work, not in inventing things that will make us put more pressure on the ecosystem, but to innovate so that we're able to restore the balance between us and the animals and plants. And that is the responsibility all of us bear. We've spoken enough. This is our 9th summit. It is time to move from talk to action. I remember when I was a young kid growing in the village, we were asked not to go to the forest on Tuesdays because the spirits of the forest were walking around. And if they caught you, they would deal with you. And so we were afraid to go to the forest. Those who lived by the coast were not allowed to go to sea to fish on Tuesdays. I only grew up to learn that it was traditional knowledge. The sea needed one day to rest. The forest needed a day to rest. And so in every month, there were 4 days that nobody went into the forest to disturb the ecosystem. Today, that traditional knowledge is dying. People now know there are no spirits in that forest that are going to harm you. And so they go to the forest every day and go and chop down the trees. And so in Africa, we also want to see how we can revive some of the traditional knowledge, the herbs, the healing, so that we don't always rely on chemical palliatives or chemical products as cures. There are a lot of traditional medicines. For instance, the neem tree was good for malaria. When we were growing up, there were no chloroquines and everything. And so if you had malaria, they boiled water and covered you with a blanket, and the steam went into your body, and then they gave you some of the bitter neem tree to drink, and people got cured. Today, we've abused all the malaria drugs. We have to keep improving them and improving them. All the antibiotics and things we keep swallowing. And so the task is hydra-headed. And sometimes when I sit and listen to these panels, I don't know even where we should start to tackle the problem. But like I said, we have a responsibility as a human race to solve the problem that we created. And it depends on all of you, the scientists, all of you, the nutritionists. And that's why we gather here and we discuss these issues. And I think discussing and networking is good. I'm leaving here with more knowledge than I came with. And I think that, yes, we've spoken. A lot depends on us too, as political leaders, to do our part, because some of these things will not work if the political will to implement them is not there. And so on behalf of world leaders, I don't know if they all agree with me, I pledge that we'll do our part. Because we must leave the world a better place than we met it. For our young people, we saw the video. They said, yes, it's our future, but we're planning that future today. A future without plastic pollution. A future without poisoning. A future without conflict, because it even goes down to conflict. All of us are watching what is happening in the Middle East, and I express solidarity with our brothers in the Middle East and hope that that conflict will come to an end as quickly as possible. Because there are many things that we face as a world, and we need peace to be able to resolve those issues. And so we solidarize with our brothers in the Middle East and hope that the conflict comes to an end as soon as possible. And so let's innovate, and let's act together, and let's move from talk to action. Let's move from networking to implementation. And so on behalf of President Macron, my co-chair, I want to thank all of you very much for coming, and those of you who acted as resource persons, we thank all of you. And I wish all of you a very safe journey back home. Thank you very much.
Thank you. Thank you very much, Excellency, Mr. President, for such a powerful message. Before we all go back home, I hope with a lot of new knowledge and ideas to implement in our own home countries, we will now create a link or build a bridge with something that is happening not far from here at the Matmut Stadium in Lyon. There are about 1,200 experts from the collaborating centers of WHO that are gathered in person or online. They've been watching us all day. They've been listening to us. There's a powerful message from Dr. Tedros and President Macron that we are going to show them in just a minute. But I want to thank you all really deeply. On behalf of the government of France, I want to thank all the organizers, all of you that have contributed with very powerful messages, Excellencies. I am because you are. We are all interconnected. All of us, wherever we come from, there are no borders to health, that we know, but there are also no borders to human health, animal health, and the environment. If we can take those two very meaningful and powerful ideas home, this would all have been very powerful and interesting and important. And I agree with you, maybe we can speak on behalf of world leaders, maybe not all of world leaders, but there's a lot of world leaders gathered here in this room, and I want to give a very big applause to all of them and to all of you for this very interesting journey.
Mesdames et messieurs, bonjour. Je suis avec le docteur Tedros. Nous sommes à Lyon, en train de clôturer le premier One Health Summit, qui est un grand succès grâce à la mobilisation de tous. Et je veux à nouveau remercier le docteur Tedros, les équipes de l'Organisation mondiale de la santé. We have a common daughter with Dr. Tedros in Lyon, our academy. And we do cherish this daughter with a lot of people and teams. And I want to say hello to the whole team of the academy, but more broadly, I want to congratulate all the WHO teams. And I want to thank you because you use this momentum of our One Health Summit to gather for the very first time all your collaborating centers. Exactly. More than 800 of them, 2/3 physically in Lyon and 1/3 virtually. And it was the occasion for me to pass the message of mobilization. We do count on WHO, we do count on you. And the whole purpose of this day, even the discussion we had this morning with head of state and governments and international organizations behind closed doors, is to consolidate WHO as the cornerstone of our global organization. We do need science, we do need trust, we do need cooperation, and we do need action. And this is the narrative and the purpose of this day. And this is why this One Health Summit will allow to launch a series of initiatives. We announced a dozen of initiatives involving international organizations, governments, companies, NGOs, and so on. But it will mobilize as well the knowledge and the professionalism and the excellence of your teams. And I want to wish you good work. And I want to commend you for this initiative with all these centers being mobilized. So thank you, Dr. Tedros.
Thank you. Thank you, Your Excellency, Mr. President. Actually, it makes your, today, your being with us makes it even special because it's our birthday. It's 78th anniversary of the establishment of the World Health Organization. And hosting this meeting, One Health, with this great attendance of heads of states, ministers, is the best gift for our World Health Day. So thank you so much. And then the other is, as His Excellency said, the WHO Academy is established here, opened its doors in December 2024. And now we believe that this daughter of ours, the WHO Academy in Lyon, will be a game changer, especially in building country capacity. Because what we have been saying is the most important, especially today, is country ownership and country capacity. And result can only be delivered at the country level. So the WHO Academy will support countries who need support from WHO. And I want to thank Your Excellency and France for the support in making this happen. Of course, the last but not least is another historic moment in Lyon. This is the first ever global meeting of our collaborating centers. 800. These are centers of excellence throughout the world. And this is the first time during our 78th birthday that we are having this global meeting. Although this is the first, it will not be the last. We will continue to have meetings with our collaborating centers on regular basis. And this is part of the reform we have started to work more through our collaborating centers, because we have excellent institutions, not only the 800, but more that we will recruit in the future. So to all collaborating centers who are in Lyon, welcome from me and also from His Excellency, the President. You have our full support and appreciate the support you're giving to humanity.
Thank
So,
you.
Merci beaucoup.
Merci, Dr. Tedros. Thank you. Et bon courage à toutes les équipes. Bon travail.
Thank you. Bon travail.
Allô, allô. Mesdames et messieurs, la session de haut niveau est désormais finie. Merci beaucoup pour votre engagement. Retrouvez-nous sur les canaux et les réseaux sociaux One Planet Summit. Vous êtes, donc je suis. Bonne journée mondiale de la santé. Ladies and gentlemen, the high-level session of the One Health Summit is now closed. Thanks a lot for your engagement. Please find us on the social networks One Planet Summit. All the sessions have been live recorded. I am because you are. Happy World Health Day, everyone.